the Indiana Register. And there's a lot of different boards that had the fee and fine rule, and they all publish that 60-day requirement notice. I imagine my assistant section chief will ask about it. You can look at the statute, you might not need to publish it, and you can just give the legal reasoning why it should be published, and I'll put that in my rule memorandum. And then when I submit it to my bosses, then they won't ask about it maybe.
Okay.
So.
All right, well, if there's anything,
Yes.
you say Sarah's done this before?
Yeah.
I have parole documents.
And I gave some examples to her in the.
Good morning. Let's go ahead and call to order this special meeting of the Indiana Board of Veterinary Medicine. I count that we have 5 members of the board present and 1 member of the board with us on the telecommunication phone line. So we are good. We do have a quorum. I would accept a motion to adopt our agenda that's before us.
So moved. Second.
Got a motion and a second. All in favor signify by saying aye.
Aye.
Same sign for opposed. Hearing none, the agenda is adopted. We should have in front of us previously sent to us the minutes of the meeting from the October 23rd meeting that we had. Are there any additions or corrections to those minutes that anyone had noticed?
Oh, I had one thing, on the Fleck case, I had to abstain.
Okay, and
So
it didn't,
in the minutes, it didn't say
okay.
that. That's the only thing.
Oh, okay.
Dr. Fleck, because of the settlement conference, I had to abstain from that.
I remember that.
Okay.
Okay, anything else as far as corrections or additions? Hearing none, I would accept a motion to adopt those minutes from the meeting and get those put into the record. So moved. Excellent. Got a second?
Second.
Thank you. All in favor signify by saying aye.
Aye.
Opposed, same sign. Excellent. Okay. We are ready for our rulemaking discussion.
All right. If you all recall from when we did this back in January of this year, that with Rule 3 and 10, that this is just a discussion. You're not voting on anything today. It's not a public comment period or a public hearing. So if anyone attending from the public has questions or comments, it would be up to the chairman's discretion as to whether we're going to hear those. There will be a public comment period later after the rule is actually drafted and ready for you guys to approve. Well, before you approve it, there will be a comment period. And then we'll vote on it like we did at the last meeting with Rule 3 and 10. Does anybody need or want a fresh copy of all of the rules now as they are written before we start for any reason? You don't necessarily need them. I just didn't pass them out in case. So moving to Rule 1 and 2. We're just repealing them and moving the content from Rule 1 and Rule 2 into Rule 5. Is there any comment or concern on these?
We talked briefly on that, and I'm not aware of us losing anything by making the move, having anything deleted that shouldn't have been. So
Why would we do it? Why delete them if they're already there?
Well, for one, we want to put everything in one spot for clarity and convenience. And literally Rule 1 is just the standard of care and nothing else. So instead of splitting everything into veterinarian and RVT, we're putting all of the professional standards together. And then we also have revamped the standard of care, beefed it up a little bit, made it more modern. Okay, so we'll move on to Rule 5. So Section 1, professional standards. The proposal is to repeal because it's either, the contents of this are either duplicative of what's already in the Practice Act, or we've moved the content to one of, like, Section 4 or 5 below. And then also just that very first sentence where it says a veterinarian may be found guilty of incompetent practice is kind of wonky. And it also only applies to veterinarians, not RVTs. Any questions, concerns, comments on repealing Section 1?
I think that's pretty straightforward.
Section 1.5 is a new section with definitions. These definitions are needed for various reasons. And we looked at the AAVSB, ABMA, and other jurisdictions to come up with these various definitions. We have had, for the definition for complementary and alternative therapy, we received calls a lot from people wanting to go to like osteopathy school they're not veterinarians, and they don't understand that, at least in Indiana, osteopathy would be the practice of veterinary medicine. So I think having a definition of what complementary and alternative therapy is in where these people can look at it and we can have some authority to it is needed. And then emergency care. We've added the language emergency care later in this section, but there's also some other sections, and I think some from the actual Practice Act that talk about emergencies, so we wanted to give that a definition as well. Immediate supervision is new to this jurisdiction completely. A lot of the other jurisdictions have it, and this one specifically is defined as the supervision by a veterinarian who is an audible and visual range of the person treating the patient. Do we have any comments, questions, concerns so far?
I have two things.
Okay.
One is, do we want to put massage therapy into the mix with alternative? Want to specifically mention that or leave it alone?
We want to, right now, I think we should leave it alone because it is specifically permissible with equine massage, and we don't want to confuse anything that.
So at what point did that get put into permissible for equine massage? Did we vote on that somewhere along the line and I'm just missing it?
It's in the Practice Act.
Okay. Was that when you redid the Practice Act a second time?
I don't recall if that was in there prior to it or not.
Because it came up a few times before our board, and I don't recall how we handled it. Because there had been some complaints about people advertising massage therapy, charging a fee and teaching a class, and that sort of thing. I don't know if you remember that, but.
Now, is there a concern about that, or are you comfortable with
I'm just throwing it out.
that being done? I'm just curious where we land on that.
I think there's kind of a fine line sometimes between chiropractic manipulation and massage therapy.
Agreed.
You know, I'm just playing devil's advocate and throwing it out there. But if you said it specifically I was involved in the first Practice Act revision in 2007, but it was done later. So I wouldn't wasn't on that second committee, so I didn't recall. So it's that, if you tell me it's in the Practice Act that equine massage therapy is permissible,
Mhm.
then I would agree. I think we have to leave it. Because you can't separate it out.
Okay.
And then on the immediate supervision, what's the difference between that now and direct supervision?
Direct supervision is just on the premise, the veterinarian, or there's a couple more nuances that we're gonna talk about later.
Okay.
But essentially the supervisor has to be on the premise. They don't have to be in eye and earshot patient.
Okay.
So it is a more strict form of direct supervision.
So all immediate supervision is also considered direct supervision, but not all direct supervision is immediate. Right? So,
The reason why our young ladies are here, I'm sure that's one of the topics. That's where I think it's gonna come into play, the difference between, when we get down the road, between RVTs and assistants, immediate supervision versus direct supervision, because prior it was just direct and indirect. That was the major.
And we had a major case like that not too long ago, this year, I think.
Well, in that case, the individual wasn't even at the clinic.
Well, that was indirect at the telephone, but
Right.
not able to
I don't,
go to the.
And I don't have a problem with that. It's
I
just,
do.
it's, no, I mean, the definition
Okay.
that immediate is more restrictive.
Mhm.
Because that's gonna be important as we progress through this.
In looking at the tasks that we go down through on that sheet of registered veterinary technician versus assistant and go through that. So, okay,
And right now, there's nothing on there that is immediate for an RVT anyway. If that was your concern.
Yeah, I think that's gonna be the technician's concerns as RVTs. There needs to be a delineation between the level of supervision required for them versus an on-the-job training system.
Right, there is.
I know, I'm sorry. But we're in definitions, so that's why I was trying to clarify the difference.
Oh, okay.
So the doctor has to be on the premises, but in immediate, he's gotta be, or she, thank you. The veterinarian must be, like, I'm in the surgery room, the door's open and they're in the prep. Direct means that doctor can be in the exam room or sweeping the parking lot. There.
okay, let's move on.
Okay. Informed consent. Did anybody have any issues with this definition?
Does it need to be written or
That
not?
was my comment. I think it should be written.
What could it be in the notes?
This is just the definition. This isn't a requirement. Okay, requirements are later, and we have intentionally left written out of the definition.
Okay.
However, you can obtain informed consent over the phone, and it just needs to be documented.
So it does not have to be. That's fine. Just clarifying it. Because we have had lots of cases arise, cases that are submitted to me where should there be written consent for anesthesia and surgery? That's down the line also, I'm assuming.
Okay. Next is a routine food animal management practice, and I felt like this needed to be in the Practice Act or in the rules because it is referenced in the Practice Act for what RVTs can provide. And we had a case not too long ago where a veterinarian used this to reference his rationale for allowing his techs to perform spays or neuters. Sorry, I don't want to. I'm learning. So I thought it was important to add some of these tasks that can be done. One question that came up was whether dehorning should be part of this definition. If it was more surgical than not. So that's for you guys to discuss.
I don't think that's an issue for most of us. Technicians have been trained, at least where I was teaching. That was one of the tasks that we covered. But that's again, something that I think may need to be separated out from down the line from registered, educated, accredited technicians.
Well, assistants can't do this anyway under the Practice Act.
Right, so I think we're fine to leave dehorning this, but
Supervising veterinarian, self-explanatory. Surgical operation. As used in the Practice Act, this was like my very first task in October of 2024 was to come up with a definition. And guess what? There weren't any definitions anywhere. So because of my inquiries, this is now the AABSB definition. And we have decided that it would be appropriate to adopt this if you all agree.
I agree, but I feel like we need to add something about not already listed in point 5 to cover us on the castration, because technically there is incision of tissue, technically there is removing part. And I like how, I think that's a really good definition of surgical operation, because that excludes things that we're trained along techs and vet school where techs can easily do this. Those things are separate from this surgical operation definition. But I think we need to say something about the ones that are mentioned in 5 are still okay for learning.
Okay. So you're okay with a vet tech doing surgical castration?
Well, to me, castration of a cow, of a whole calf, let me be more clear, can still, like, you could still weasel your way into this definition. And I like to kick the weasel out of that. Does that make sense? Because I feel like that one case you talked about in this definition is just a little bit too open for him to still scoop in and say that castration is an incision and a removal.
Has it always been in the Practice Act that technicians can go out on a farm and do some of these large animal?
It's not,
So it's not so it says that they can perform routine food animal management practices under direct or indirect supervision. It does not define the
What that
routine.
is?
Yeah. So if you don't want castration in there, then say so.
We cannot separate it out between large animal and
Well, I think-
small animal.
I think the intent behind the routine food animal management practice is that it is large animal. So it would only
So
be permitted under
5,
that, yeah.
right. I think that's
So
okay.
can you add something about 5 to the definition? See what I'm saying? To exclude it?
Yeah.
You know, something like excluding provisions in section 5.
So this is just a definition though. So, Gary,
Or do you just delete castration from the definition of routine food animal management? If you don't want it to happen, then you would just take it out of.
Well, I think
We're
we're
looking on
fine,
the large
we're
animal
fine with
side.
food animal castration, not someone using that to have technicians castrate cats in their small animal.
But, I mean, later on, you have substantive provisions that say you can't do surgery.
well, except necropsy.
Yeah, but anyways, if you're okay with food animals, if technicians castrating food animals, then that is what this allows.
So is this more of a, we'll get to it again further in the thing?
Kind of, this is really just a definition of what surgery is.
Just wanted to get us down the road when it's saying, but this is your definition of surgery. Technically, this is.
Well, in 5, can't we just say, this does not include any small animal procedures, or say something along the lines of, this definition exclude, what's that?
Just think that it gets more wordy and,
Yeah.
and
Well, it does, but how else are you gonna prevent somebody from sliding from the definition in 7 to
Well,
allowing 5 to accommodate it?
If you wanted to define food animal, you could. You have a separate definition for food animal, and then therefore routine food animal would only apply to food animals. And you're gonna say what food animals are if you thought you needed to do that.
But we have that in 5 right now,
No, you don't.
No.
You have food animal management practice.
okay?
I
So what
don't
is
know what a food animal is.
Yeah.
So,
sounds like an animal you eat.
okay,
Yeah,
So-
I mean,
so then we can come up with a definition.
if you wanted it to be clear, it did not include small animals, you could define food animal, but I think you can decide whether that's necessary or not.
Could we just say something about excludes cats and dogs on 5?
I don't want to change definitions in the manner that we're talking about right now. We can either add definitions, or we can build on to the requirements further down the line,
Section.
because these are just definitions right now. The definition of surgical operation doesn't necessarily change, but you can state who can do certain things.
Definition is good.
Sounds like we're getting too hung up in this.
These are just definitions.
Right.
The requirements are in sections like 4, 5,
That's what
and
we're having
6,
discussion.
mainly section 6. Okay, any other questions on that?
You can beat that up adequately.
So section 2, I have just changed the wording on here to make it veterinary medical records instead of animal health records, to align it with the Practice Act. In the statute, it says veterinary medical records, not animal health records. And then paragraph D in there on the next page is already in the Practice Act. This was just never, these have been revised in 20 or 30 years, so the Practice Act got updated. The requirement is the same in the Practice Act. This is just a deletion to this duplicative. Questions, comments, concerns?
It's easy.
We may revisit medical record keeping later, but right now this is the only proposed change. Okay, so section 3, reporting.
Doesn't give any definition of what records you're talking about. I mean,
That's in the Practice Act.
how to write it down or whatever. A record is a record, I guess, but
So there's it's more defined in the Practice Act. And this rule just says, what needs to be in it.
So on section, on section D, retaining for 3 years, that's in the Practice Act somewhere else. So we strike that.
This is
Got it.
So moving through to section 3, reporting of substance abuse or psychiatric impairment. The only changes, it's in paragraph A, is, and I had to update this yesterday afternoon, so if you don't, you'll have it in your packet, but if you were reading through it earlier, the first sentence where it says a practitioner is and then sick, we're striking is sick. Because that's just a grammatical error that Legislative Services added the sick part to, and we're just getting rid of it to clean it up. And then for A1 and 2, we're just cleaning that up to align with the Practice Act. So just using licensed veterinarian and registered veterinary technician. We're no longer part of Title 15, that's the Board of Animal Health. And this definition for veterinary technician says that they work under the direct supervision of a veterinary or licensed veterinarian. That's not accurate with the Practice Act. So those are the only changes in section 3. Any questions?
Is it section 3 that has notifications of psychiatric and substance abuse? Is that correct? That's in section 3.
3.2, I think.
I don't know what you mean by notifications.
Further down, reporting of substance abuse or psychiatric impairment, are we there?
I mean, this is in this section, but we're not
talking.
We're not changing
We're not.
anything.
There's no proposed changes today.
Okay.
There's something in there that you're not happy with.
No, I think it comes further down the line about notification of a conviction or felony. That's further down the line. It's fine, okay. I'll cross that bridge when we get there. I was thinking it was up to 3, but it's further.
Oh, okay. So section 4, professional standards for licensed veterinarians. Do you want to go through them one by one, or do you want to point out if you have any questions, comments, concerns? Just go through them. Okay, so so A is that definition of standard of care, just beefed up a little bit. Licensed veterinarian shall exercise reasonable care and diligence in the treatment of animals consistent with that of a reasonably prudent veterinarian under similar circumstances and in accordance with generally accepted scientific and professional standards of veterinary medicine. That's good. B, a licensed veterinarian shall be responsible for having knowledge of the standards of conduct and practice as established by statute and rule pursuant to the Practice Act. C, failure to comply with this article may result in disciplinary proceedings against the offending practitioner. D, all licensed veterinarians shall comply with the following non-exhaustive standards of professional conduct. 1, the veterinarian shall not knowingly provide prescription drugs or access to prescription drugs for use other than in the proper course of veterinary diagnosis or treatment. 2, a veterinarian shall not represent to the public that they are a board certified specialist in any specialty of veterinary medicine unless that veterinarian has been certified by an entity approved by the American Veterinary Medical Association's American Board of Veterinary Specialties.
So on 2, we're using the word board twice. And I was thinking, we do have situations where a veterinarian shall not represent to the public that they are instead of board certified, that they are a certified specialist, and strike the word board. Because we have had situations where veterinarians, either by word or mouth or through technicians or whatever, will hold themselves out as, oh, I specialize in orthopedic surgery, without them coming right out saying, I'm board certified. They'll hold themselves out as a certified specialist, not necessarily board certified.
Well, it's the ABMA's American Board of Veterinary Specialties, so it is a board certification.
Right, but that's further down. I'm just saying in that first line, if you strike the word board, veterinarians shall not represent to the public that they are a board certified. Because there are veterinarians representing themselves as a certified specialist, but they are not representing themselves as a board certified specialist. They're just telling the public, I'm a specialist.
So this, you're saying the way it's written now would give them an out because, oh, I'm not saying I'm
not-
board
Yes,
certified, I'm just a specialist.
I'm just a specialist. If you strike the word board, because it's in there, it's in there further down. The next line is appropriate. You have to leave American Veterinary Medical Association, American Board. I agree with that. What I'm saying is, if you strike the word board from that first sentence, it prohibits people from holding themselves out as a specialist. But their
Well, I
their
think you can
defense is
still
to say, well,
specialize in, so you only do orthopedic surgery. You are specializing in that. That's all you're doing.
there
or
are-
you're
there are
small animal
veterinarians.
specialist.
There's veterinarians that basically that's all they do. They're not board certified.
right. And
And they're good at it, don't get me wrong, that's not the point.
right, but they'll hold themselves out as a specialist when they're not. And their way around it is to say, well, I never claimed I was board certified.
Well, I don't think you guys can live, I mean, they have a full license to do surgery and practice veterinary medicine. Like, you don't, the board certification is very particular because the ABMA has this group that offers these board certifications. I don't think you have the authority to tell a veterinarian that they can't say, well, I specialize in orthopedics. Because there's no limit on their practice to do orthopedic surgery.
But they're
But I think,
misleading the public.
I think it gives the people a false sense of what their qualifications are. I agree with Paul 100% on this because I've come across it as well. To the point that we have doctors in our practice that are really good at certain things, whether it's reproduction or whatever it might be. However, I have never let them use the word specialize because I think that gives that false sense of, it's okay if they say, hey, I have a keen interest in this area. I have advanced training in this area, but I don't like that word either for those reasons.
Can you just include them both in that same?
Well, all I'm suggesting is a veterinarian shall not represent to the public that they are a certified specialist in any specialty of veterinary medicine unless that veterinarian has been certified, board certified by the ABMA. I just think striking board from that first
Takes care
half
of
of
that.
the sentence covered,
I agree.
I agree.
because we do run into it. We run into veterinarians,
Name
Us
2 or
is-
3 right now.
yeah, that have been around enough that you see veterinarians holding themselves out as a specialist, and the public assumes they're board certified, but they're not.
So Paul, sorry to jump in real quick. So by deleting board, right, would you also need to strike certified? Because I mean, I can say I am a specialist, like an orthopedic surgeon, And as long as I'm not saying I'm a certified orthopedic surgeon or a board certified orthopedic surgeon, we're not really getting to I think what you all are looking for. Because I do think I lean to where Brittany's at, only because I think we have to be careful at what we're allowed to limit them saying in this space. I agree, advanced training, there's a lot of space there, but look very carefully at both board and certified, because if they're not saying one or the other, are they still saying they're a specialist?
So are you recommending we strike, if we're going to do something, we strike both board and certified from that first line? And just say that they are a specialist?
Right. So to me, it's either all three words together or strike board and certified and leave specialist. That's
I'm good with that too.
You good with that?
I agree.
Okay.
So all we're gonna say is veterinarians should not represent to the public that they are a specialist in any specialty unless they're board certified. I like that.
Okay.
That makes,
And there's not you don't see us overstepping our bounds by doing it. I agree. I'd like to do this. I just want to get your opinion since you guys have done the research on this.
Yeah, I think that as long as you say they can't hold themselves out as a specialist and not that they can't
Do it.
specialize, or even have like a surgery center, even though they're not board certified surgeons.
A surgery center is where surgery is performed. Doesn't mean that the board certified.
You do that every day.
I do surgery every, no, I am Mondays and Tuesdays.
Oh.
But you could.
But I could.
I'm sorry, but this is.
the other thing
Okay,
we
you
may
have to
need to
share.
include. Sorry. The other thing we may need to include is, are they able to call themselves a specialist if there is not a accepted specialty by AVMA?
I wouldn't go down that road.
Okay.
I think we can leave that part up to interpretation as the case arises before.
because quite honestly, that changes, AVMA changes that if they get enough people in a specialty wanting to be recognized. That's it. They have to
Right.
jump through some hoops.
They go through an exhaustive process to get their specialty area board recognized as a board. AVMA, House of Delegates has to vote on it.
Okay.
Next.
Okay, 3, a veterinarian shall maintain and document informed consent from the client in the veterinary medical record prior to initiating any recommended treatment unless the veterinarian is providing emergency care. And the extra M was deleted.
So the original one where the M was in there, but it said obtain. So is it shall? I didn't pull it up in your new printed one.
It's still,
It's obtain. Okay.
Versus what?
I thought you said maintain and document, but it's,
well, I may have said that, but I
Okay.
meant obtain.
okay.
Because that's the word that I read,
I'm good.
thinking of the M. And so this is, because I'm reading not the old one. Okay, I have all my notes in the side.
Okay.
So it's fine. So this is where it's clear that the form consent needs to be documented. Dr. Shipman felt that it was important to make sure that between the definition and this requirement for veterinarians that it is open to having an assistant, a tech, other staff member who's properly, trained, actually get that informed consent depending on the veterinarian's, professional judgment. But it has to be in the medical record, period. And it can be obtained over the phone. If you're doing something surgical and something comes up and you need
Yes.
further consent, like I've had cases like that and they didn't get the extra, consent. And you guys did something time. 4, a veterinarian shall comply with the board's request to appear before the board, to provide information to the board, or to make their premises available for inspection by the board. There, in the Practice Act, there are limiting circumstances where the board, in collaboration with the AG's office and the Board of Animal Health, will go in and do some inspections. This doesn't open premises up for inspection beyond what is in the Practice Act. So you guys we're not going to just start showing up at practices. Okay, any questions at all? 5, a veterinarian shall notify the board within 30 days of the occurrence of the following events: disciplinary action or revocation, suspension, or voluntary surrender of their license to practice veterinary medicine in another jurisdiction. B, the suspension, revocation, or voluntary surrender of their United States Department of Agriculture Animal and Plant Health Inspection Service accreditation. C, the suspension, revocation, or voluntary surrender of their DEA registration. The suspension, revocation, or voluntary surrender of their state-controlled substance registration. Or the conviction in any jurisdiction of a felony or misdemeanor other than a minor traffic violation. Dr. Clemente,
Yes,
is this where you have a question?
yes, ma'am.
Ask your question.
My question is, because I've been asked this in broad terms, and I always tell the person asking, do not give me any details. But I've been asked, what happens if I get a DUI? And I guess what I've said is make sure when you go to renew your application that you check yes on that box. That you've had a criminal conviction for a DUI. Does this mean that the veterinarian or technician has to report that prior to the renewal, that they only have 30 days to tell?
Yes.
Okay.
Because they could go 2 years with a substance
Right, right.
issue, a substance disorder.
Because the 2 times I asked that, I knew I get asked right before a renewal. Oh, by the way, and I say, stop, don't tell me who you are, who it is, whatever. But let's just suppose I get asked, a veterinarian, and you read between the lines, what's going on. And I guess it's been close enough, the 2 instances I had to a renewal, where I said, make sure you report it. Don't check no on those boxes. But what you're telling me now is if I get asked that question again, I need to say, you have 30 days to let the board.
And sitting here at this point, I don't think the general veterinary population knows or does that.
No,
I would agree.
it doesn't happen.
I mean, I think they're only reporting it when they go to renew. So
I
how do you
think the
disseminate that
30 days is
information? Do you-
good because there's more and
Make a
more,
rule.
They all, if
more
they
and
see
more
it.
times.
They're gonna see it.
Well,
That's
but
it.
Well, they don't have to delve into the Practice Act to see it though, right? I mean, are we gonna be sending
Yeah,
these rule changes out to everybody so they can see it?
absolutely. I mean, in our bulletins, oh, absolutely, yeah.
Is this a change? 30-day
Yes.
reporting, that's a new. So what I
That's a good idea.
said in the past, I was not necessarily wrong.
No, they have to report it. As the questions stand right now, it is, since you have last renewed, have you been convicted
Right.
of? We can change those questions too, to make it more reflective of a new rule change, but since this isn't an actual rule yet, we haven't changed anything.
Okay, so this 30-day reporting is something new for us.
And that will be new for the registered veterinary technicians as well.
In the
Right.
next section, yeah.
And of course,
Just giving them
it's
a
a draft.
It's just a draft too, so
You don't have to do it.
Not to
Or you can
go
make
too
it
far.
60 or 90.
No,
Not to go too far off, board, but just thinking ahead. if this all does come to fruition, and they have 30 days in there, you said then we can change. Because I'm just thinking, if it happens right after renewal, and then they have to let the board know, and then we take whatever acting, whatever comes up, then when they renew,
We
we'll
can
have to change the
it.
wording, correct? Because it hopefully will have already been taken care of before that renewal, and they don't have to like report themselves again. So we just need to be thinking about that when the time comes to
Yeah,
change those
yeah.
questions. So I'll say.
But also, if you look at paragraph E here, it is reporting a conviction, not an arrest. Okay?
Right.
So even so, they could still have been arrested and not go to trial or sign a plea agreement or whatever for 6 months or a year after the arrest. But this at least helps get some folks in here in that interim during the renewal, or the 2-year period before you renew.
Because we've had many cases where DUI occurred a year ago, and it took them 6 months to get that conviction and probation over with. And if they come to, and if they happen to come to us before that 6 months, we always postpone a decision until the criminal terms are over. So that's why I think that 30 days is a good idea. Because a lot of times we're seeing these individuals, they still haven't done their criminal probation work. And we've always put them on hold until that criminal probation's over.
I think 30 days is great. I hate to say it, but we're seeing more and more of that, I think. Unfortunately. Then we're getting into ethics and morality.
Okay, any other questions on that?
No?
Okay, 6, the professional services of a veterinarian shall not be controlled or exploited by a lay agency, personal or corporate, which intervenes between the client and the veterinarian. The veterinarian shall avoid all relationships which could result in interference or intervention in the veterinarian's practice by any person or entity.
What does that really mean?
Yeah, can you give an example of
It
that?
means that the professional judgment of the veterinarian shall not be influenced by other relationships or business partnerships that they have. So you can't, as the owner of a practice, you can't make your veterinarians, your associate veterinarians only prescribe a certain drug
If you're a
or
non-veterinarian owner.
or a non-veterinarian owner, make them use a certain pharmacy or.
Oh, to
The
benefit.
corporate does that all the time, don't they? Corporate has their own, I mean, for instance, you know, they have the buying agreements with certain companies. I mean, it's just the way it is.
If a certain practice only wants to carry certain medications because they need to limit inventory, but this is just saying if an associate vet or them or whoever wants to say, hey, this animal needs to be on this drug, you can still scrape that out. It's still given that, right? I mean, it's not
Yeah, if your
saying.
practice only carries large animal ivermectin and you have a little collie that shouldn't get that drug, look at you.
Oh, medical and everything. Wow, that's
You guys,
Wow.
you guys,
Who is she looking at?
that was my case, okay?
I was gonna say, hey, keep me out of this.
But that was the only drug that they had,
I'll
right?
give you an example. If you want an example. You're talking about court.
Yeah.
So, NBA has struck a deal with Zoetis to go into the clinics, buy all the NexGard Plus stuff, have that clinic carry only Simparica Trio or whatever. So you as a veterinarian in that practice, if you want your patient to have NexGard Plus, for whatever the reason, instead of Simparica Trio, you're writing a prescription for chewing. It happens.
But that still seems like a voluntary thing for that practice, choose to have that relationship. This looks more like it's protecting the vet or the associates or the non-decision makers from control and exploitation of, well, my brother owns a pharmacy down the road, so you can only do that. Like some of the things you guys are talking about, I don't feel like fit into this. This is more like protecting the veterinarian for, like you read my back, I read your stuff.
I mean, that too.
Not the same as like, okay, I'm gonna sign a contract that, because every clinic chooses, we're gonna carry this, so then the benefit of that is they buy the rest of your stuff, or you have a new blood machine, well, they're gonna buy your old blood machine. Like, that doesn't sound like.
We're not
It's
limiting their
just-
ability to do what they wanna do.
Yeah.
Like
Yeah.
Paul says, they can write a script.
Right,
This is just making it,
it's just protecting.
saying protecting,
Human beings.
yes.
Could you just strike that, because I think that might be real confusing for a lot of people reading that, when I read it,
Strike what?
just that paragraph, or is that something nationally that they do, that they came up with?
What's the source of that? You remember where that?
A couple of different places,
Yeah.
but I mean, this is standard for physicians. I mean, the hospital can't control
I don't think
the
it's bad.
professional judgment of a
I'm fine with
physician, and that's essentially what this is saying, that the corporation,
I
the
think,
clinic can't control your professional judgment.
I think it's okay to leave it in
Me
there, just
too.
like this.
I'm fine with leaving it in, but it is becoming, because of corporate shifting of the number of veterinary hospitals to corporations. Some corporations are more heavy-handed than others. The one that's affiliated with a certain chain of pet stores would definitely dictate to their doctors how they practice. Others are completely hands-off. But the corporation that I just mentioned has become more heavy-handed since our particular clinic was hospital number 12, and they're up to 1,600. And as that has transpired, they've become much more heavy-handed. You will use ITEX, not Anatech. You will sell Simparica Trio, not NexGard Plus. I'm glad I'm not there anymore. I'm retired because I would have had a problem. And this would have protected.
This would have protected it, yeah, so I think, yeah. Leave it in.
I like it.
Even in private practice with a medical director, I mean, they pretty much dictate, here's how we're doing this surgery, here's how, what drugs we're gonna have on the shelf. I mean, it doesn't have to be corporate, I think, for there to be that issue to a degree
No.
anyway.
But the corporate has made it more of an issue. In the last.
And we've talked only about pharmaceuticals. There's other ways they can put pressure on you to do whatever,
So far, I don't know of any corporations that says you have to repair an ACL with a TPLO. You can't do a flow suture. So far, I don't think that's it.
In this paragraph, how do you like the second sentence there? Your veterinarian shall avoid all relationships which could result in the interference or intervention in the veterinarian's practice by any person or entity.
I like it.
Do you think the word like shall avoid would be difficult to discern for folks? Or for you guys to
Interpret.
interpret later?
No, I think shall avoid is fine. It's probably not gonna come up that often, but
there's,
Good to have it there.
I just got approached a couple weeks ago. They need a veterinarian in this organization so they can get certain things. And I'm thinking, no, I'm not gonna do that,
They want to use your license and you
Yeah.
to order drugs for them or
Yes,
stuff
yeah.
like that.
So, I mean, this stuff's happening. I think leave it in there,
So moving
Because I can see down the road, they'll we'll have a case before us.
Moving into registered
five.
veterinary technicians.
And this section is much
Moving into
shorter.
registered veterinary.
Paragraph A, a registered veterinary technician shall exercise reasonable care and diligence in the treatment of animals consistent with that of a reasonably prudent registered veterinary technician under similar circumstances and in accordance with generally accepted scientific and professional standards of veterinary medicine.
Same thing as the veterinarians, just veterinary technicians.
Yep.
All this is the same, except you just substitute veterinarian with registered veterinary technician.
B, a registered veterinary technician shall be responsible for having knowledge of the standards of conduct and practice established by statute and rule pursuant to the Practice Act. C, failure to comply with this article may result in disciplinary proceedings against the offending practitioner.
I just marked that, the word practitioner, so just my quick thinking mind, when I hear practitioner, I think veterinarian. Is this mean, I mean, and here we're talking veterinary technicians, is that also an approved word for veterinary
It's
technician?
elsewhere in all of this as well.
Yeah, so
The
but
two
now that
of
you
these
say
ones
that,
stricken.
the word practitioner is gonna come up later. So maybe we should change, going back to 4C, change it to the offending veterinarian. And then here, the offending RVT. Yeah,
I questioned a little, so I.
no, I appreciate that because.
Well, no, I saw
it's
that
gonna
as
come
well.
back.
I just thought that's the way it is these days.
Well,
I don't
it's
like
coming up here
Okay.
and it's gonna come up later when we talk about telehealth, but that's in the PowerPoint, you guys haven't seen it.
Okay, so we're changing 4C
No.
to veterinarian.
Okay.
Is that correct?
Yeah,
Didn't see it either.
four
Practitioner.
C, the last word, practitioners being changed veterinarian. And then 5C, we'll change that to offending RBT. I think that it was probably just to kind of keep it like neutral, just,
Yeah.
but it makes sense to do it this way, so thank you.
Well, the veterinarian is still responsible if the technician does something.
Well, this is just not calling both veterinarians and registered veterinary technicians practitioners, because that can be confusing.
So the section that we just went over was for veterinarians only.
So you're changing this C though, practitioner to veterinarian.
In 4C.
In
It's
4,
talking
not
about
in
veterinarians.
5. We
Now-
bounced back to 4.
Or the technicians.
We changed it in both things.
4C is now
4C.
veterinarian instead of practitioner,
All right,
and that's on page 5. Okay, in about a third of the way down.
All right,
and 5C is
Hold on,
on
he's not
page
there
6. We're good.
all right. So this here would be defending technician, right?
RVT, yes.
All right. That makes more sense.
Okay.
Proceed.
D, all registered veterinary technicians shall comply with the following non-exhaustive standards of professional conduct. 1, registered veterinary technicians shall not represent to the public that they are a specialist in any specialty of veterinary medicine unless that registered veterinary technician has been certified by an entity approved by the National Association of Veterinary Technicians in America Committee on Veterinary Technician Specialties.
Where we had to change the other one, this one doesn't have that, so we're good.
Right,
We don't make any changes.
But I have a question. So in the second line there, it says a specialty of veterinary medicine. How do you guys feel about that? Instead of veterinary technology, or is it still just standard veterinary medicine?
They're still
Still
working
veterinary.
in
I
veterinary
think
medicine.
that's good. I think that's fine.
I think I brought that up previous. Okay, 2, a registered veterinary technician shall comply with the board's request to appear before the board or to provide information to the board. 3, a registered veterinary technician shall notify the board within 30 days of the occurrence of the following events: disciplinary action, revocation, suspension, or voluntary surrender of their license to practice veterinary medicine.
I marked that one.
That one I
as
don't
well.
like, yeah.
Yeah.
veterinary technology. The practice of veterinary medicine is defined as a veterinarian only can practice that. I think trying to make veterinary medicine consistent throughout instead of adding veterinary technology everywhere. But the word practice
Yeah.
veterinary medicine, it would be veterinary technology
In this one.
in just that one.
I
Yeah.
think that's.
I highlighted it when
Do not doctors and nurses both practice human medicine?
No nurses practice nursing. So there is a definition, if you,
I'm not sure how I feel about this.
well, if you go to the packet here that says, the first thing says preamble, it's gonna give you all the definitions. I think. Okay, so if you go to the last page, but the first, so it's 2538.1-1-15. Yep, veterinary medicine includes veterinary surgery, obstetrics, dentistry, acupuncture, and all other branches or specialties of veterinary medicine. Now.
It's clipped.
It's clipped to the other counters.
Oh, okay. Got it.
Oh, that's not it.
Okay, and then if you go to 38.1-112, there's the definition of practice of veterinary medicine. And A1, the practice of veterinary medicine means representing oneself engaged in the practice of veterinary medicine, veterinary surgery, or veterinary dentistry, or any other branches. 2, using words, letters, or titles in connection or under circumstances that may include the person to believe that the person is using them engaged in the practice of veterinary medicine, veterinary dentistry, veterinary surgery. And if you keep going down, I mean, it's describing, dispensing, performing surgery, diagnosing, it's all veterinarians. All of the definition of what the veterinarian can do with this license. So I get what you're saying, Dr. Rodenbarger.
I just, how are we going to appropriately word it then?
Veterinary technology. In just that one paragraph. We have a hand being raised in the audience from a bunch of RVTs that might have some input on this if the board chairperson would like to address that. You can or cannot.
Would you like to offer some insights into this?
I would, please.
Okay.
My name is Crystal Schaefer. I'm a registered veterinary technologist that holds a master's degree in veterinary clinical care. I'm the immediate past president of the IVTA. Is there a reason why we can't say practicing veterinary nursing? It's not, we're not practicing veterinary technology. We're practicing veterinary nursing. And we're not calling ourselves nurses, but what we're doing is nursing care.
I think this gets us back into the,
RVT versus nurse?
yes.
You think it's too close? Yeah.
That would be my concern.
Sure.
Just thinking that through.
Sure. Another comment is the NAFTA comment about technicians can't refer to themselves as specialists. The word veterinary technologist means a specialist in veterinary technology. So those of us that are technologists, that might be some more clarity there, or have a definition of technologist in the Practice Act.
So as it technologist with a master's degree.
You're a technologist with a bachelor's degree of
With a
applied science and veterinary technology. Our title changes from technician to technologist, and that word in itself means specialty in veterinary technology.
Now, is that a NAFTA definition also?
Yes,
It's not a VTS.
it's not a VTS.
it's
VTS
a-
is veterinary technician specialist,
Right.
which tracks one discipline. Whereas a technologist has a specialty understanding and theoretical concepts across the discipline of veterinary medicine.
So are you concerned you're not covered by the sentence that says National Association of Veterinary Technicians, veterinary technician specialty? Does that cover you or not?
That does not technically nor legally cover us.
An alternative could be to add technologist, like something that says the technologist who have earned a bachelor's degree or something to that effect. We can look it up.
In our definitions.
Yeah, or even just like paragraph 2, add it, something about adding technologist or even here, something about this excludes the term technologist.
It's just if you're gonna add the definition of VTS, that probably should be in the definitions of what is a veterinary technician, what is a veterinary assistant, what is a veterinarian, what is a technologist, what is a VTS.
So at this point, I don't think we're adding any other term, but I understand the difference as far as special list goes, and we can work on that language. But in that other paragraph, where it says the practice of veterinary medicine versus veterinary technology.
And you mentioned the practice of veterinary technology. And when we were saying that, I didn't say it out loud, but I was like, I didn't think practice of veterinary medicine. I felt like that means veterinarian because we have those definitions. And so it makes sense to change it to practice veterinary technology, but it didn't flow in my mind either.
Yeah,
But I
because
don't
that's
know.
not really what we do with
I
the
don't
public
know.
perception. I mean, not that we're here to discuss the public perception of who we are and what we do. Technology is our degree, it's not what we practice.
Well, but you're licensed to practice veterinary as a veterinary technician in Indiana, regardless of what your degree level is,
Yeah.
right?
But you're a technician, not technology.
Right.
Yeah.
So it'd almost have to be practicing as a veterinary technician
Yes,
and not try to lump it as a ology.
because ology means the study of.
As a veterinary technician. So instead, it would read, they're licensed to practice as a veterinary technician.
Yes,
Does that work?
that satisfies the board.
Yes.
You're good?
Just a minor point, you might say license or registration.
No, we're still here.
Or certification.
Just put credentialed. That's the new
License
national
or
terminology.
I have a question for that understanding.
As a veterinary technician.
If you are, I know there's a specialty for anesthesia, for veterinary. What is the proper term for that?
VTS, veterinary technician specialty of anesthesia and analgesia.
Okay.
And that's what's
So-
recognized by NAFTA's.
Yeah,
she mentioned.
okay, that's, now I understand what, okay.
Okay, moving on to B. Veterinary technician shall also notify the board within 30 days of a conviction in any jurisdiction of a felony or misdemeanor other than a minor traffic violation. So unless there are any other questions on section 5, do we want to take a break and then move to section 6?
So are we gonna recognize the technologist specialty? Are we gonna add something about that in D?
Not right now.
Okay.
Well, I mean, we might, but I'm not gonna sit and go through the language now. We can work on it and then we'll show it. I'll show it to you guys.
We have
later.
to address that technologist specialty.
Probably, yeah.
Under that definition. I think it's great that these young ladies came. Better to address it now than wait till a public hearing and have to rehash it all.
Thank you for allowing us to go.
Yes, thank you for the
As
opportunity.
scary as you
We have
guys
two.
are.
We have two online as well that.
Now, this young lady had you had a point before we break, you were raising your hand a little. Is there a point? you
Oh,
need
no,
to-
moot point. Moot point. I was gonna bring up the, AABSB definitions of practicing medicine and practicing veterinary technology, but it's a moot point because we changed that language.
So we,
So good
Figured
job.
that out.
so we addressed your concern.
Yes, thank you very much.
There's a request for a 10-minute break, so we shall take one.
Don't hang up. Just put the microphone next to you.
Okay, let's reconvene our meeting.
So we're gonna move on to section 6, and in your packets, I would suggest taking out the chart. I will read the proposed rule, but this chart, Dr. Shipman and I worked on. I learned how to use Word documents with this exercise. Dr. Shipman thinks that seeing it visually like this will really help you guys. You have it.
Yeah, but is this the current practice?
What do you have?
The last thing on this.
Does that say abortion services?
Preamble.
Oh, preamble, yes.
Okay, good.
It's not the whole practice act. It's just the first part of it with all the definitions.
Okay. This is great because I've been on the board a long time and nobody's ever, it wasn't Paul. You know, seriously, I wouldn't know, the learning curves, if there is a learning curve, but nobody's ever said that this is what you're doing.
You guys are gonna learn a lot today. Promise.
Well, that's what getting paid
He's gonna
for.
learn it.
My $4.80, whatever it is I get.
For your travel.
I don't even know what I get.
Yeah.
Okay, section
Let's
6.
move on.
Supervision of non-veterinarians. Paragraph A, with appropriate supervision and after establishing VCPR, a veterinarian may delegate veterinary care and treatment duties to non-veterinarians. B, a veterinarian is subject to discipline if they improperly delegate care and/or treatment duties to a non-veterinarian or fails to properly supervise the non-veterinarian performing delegated duties. Question?
Just, and it may be proper or not, but the fails, when I was reading it, my mind went to a veterinarian is subject to this. Is it the veterinarian fails? Or the they fails or they fail? Or does the they go back to the veterinarian so that it is fails? So
Goes
it's
back
just
to the veterinarian, I think. You're
the
responsible.
word, no, I'm just saying the wording. I'm saying
You're
the wording.
asking the grammatical
Grammatical,
question?
yep, and I am not,
Okay.
I know just enough to wonder, but not to know. Because if you look at it, I did not. Shoulda, woulda, coulda. But, so they improperly delegate,
They.
or they fails to properly, the fails, is it go back to the they? If you go back to the veterinarian, then fails is correct. Again, just,
Wait, I'm gonna
I don't want
circle
a
it.
sick in here in a few years later, SIC
Are
said.
you trying to diagram a sentence?
Yes. That's
So,
exactly-
They refers to the,
Correct. But should it be fails or fail? Because they fails doesn't sound correct to me.
Kyle, are you
We-
still on?
Dr. Shipman is still here, but since this is just a grammatical question,
Yeah, that's
we'll
all.
move on
Fine with
and
me.
deal with grammar lessons.
Well, the problem is veterinarian is singular and they is plural. So they,
Well,
it
they
should be
is
a
gender neutral.
veterinarian is subject to discipline if he or she improperly delegate care, and then you have fails,
Yeah, just start.
would be my guess.
Figure it out later.
Well, I'm just, I live with a language arts.
But we had they in there, and so they fails. It sounded-
So we
No,
can,
See?
we can consult the teachers. I would love to do
You started, I know.
This is right.
Move on.
This is right.
Fails is not a plural or singular. It's-
Go on.
You could have failed.
Okay,
Yeah,
C,
failed.
licensed veterinarians are prohibited from delegating the following tasks to non-veterinarians. Surgery, except when acting as a surgical assistant to a veterinarian. Diagnosing, prognosing, and prescribing. This is where we have that question with the castration. Let's just keep moving along and then we can circle back to you guys with a proposal as far as how to like approach that, unless you guys have very specific ideas right now. Okay. Because in the Practice Act, it's very explicit that techs and assistants cannot operate as surgeons, diagnose, prognose, prescribe. So.
Yes, sir.
D, subject to Practice Act. In paragraphs C, E, and F of this section, licensed veterinarians may delegate other tasks to veterinary assistants under direct supervision. That is the baseline under the Practice Act. Okay, now subject to, this citation is, it's the veterinarian's professional judgment that that assistant is properly trained and able to do it, okay? And we can open up, you guys have the delegation packet here in the next packet, not the one that has the preamble on it. But the first thing says identification of registered veterinary technicians. If you turn to page 3. This is the statute that dictates the level of supervision of veterinary employees. So here it says A, a supervising veterinarian shall determine and is responsible for determining, except where prohibited by law, if the tasks being delegated are commensurate with the employee's training, experience, and skills.
You're on 3.
Yeah.
Well,
Oh, no, of the statute.
identification.
It's probably in that packet you have, like, the clipped packet in your right hand. You clip it.
It'll come apart in there.
It's the
Individual
last
packet.
staple thing.
Don't look at the numbers, just go to the.
All right.
Um, So just going back to that statute that I just referenced, that paragraph A on that, that is just showing that it's ultimately up to the veterinarian's discretion on what they're gonna allow an assistant and an RVT to perform, okay? With some exception in intermittent. But that baseline under the statute is also veterinary assistants can do certain tasks under direct supervision. Okay? And we're back
Oh,
on
we're back to
section
draft.
6, sorry.
Okay, got it.
D, section 6D.
Yes, I got it.
So then E, licensed veterinarians are prohibited from delegating the following tasks to veterinary assistants. Subcutaneous tube or drain placement and minimally invasive scope assisted procedures.
I agree. Where did those words come from?
The AAVSP.
That's close enough to me.
Out of all of these things listed, how did they come down to those two?
Well, they would be
Or,
Dr.
I'm
Shipman.
just trying to wrap my mind around
Dr.
those
Shipman,
versus all of this stuff.
paging Dr. Shipman. He's on here somewhere.
1 second.
Um,
Yep, I'm here. Sorry.
Did you hear the question?
It's just yeah, I did. Yeah, so basically we hacked through that. The chart is what we actually worked off of. There was actually several more that were on that prohibited list, and we didn't feel that it was in the best interest of the state and the profession in Indiana to keep them as prohibited. So we moved them from prohibited to immediate for veterinary assistants, but these are the two that we thought were still in the space of didn't feel comfortable enough putting them to immediate. So the list was much longer of prohibited tasks completely, but felt that that was a little too restrictive on the veterinary assistant and felt like a veterinarian should still be allowed to delegate that task under immediate supervision of a veterinarian to complete those.
And part of that is because the General Assembly has stated in the Practice Act that veterinary assistants can do tasks under direct supervision. So we've come up with a way to, under your rulemaking authority, to show that that you guys can prohibit some stuff. You can dictate that veterinarians are prohibited from delegating certain tasks. We can add to this if we want. These are just what we came up with so far, and like I said, there's going to be more discussion later that we may want to revise a lot of this. So for now, and don't forget, up in paragraph C, veterinarians are prohibited from allowing techs or any non-veterinarian from doing surgery or prescribing or prognosing or diagnosing. So it's not just these two things, right? And then there are other tasks in F where the veterinarian may delegate certain tasks to assistants under, only under immediate supervision. Which means with the definition, if we adopt it as written in section 1.5, would be veterinarian supervision, at least in audible and visual. Audible.
Okay.
Clear as mud. Okay. So then with the immediate supervision, the task would be, and don't forget, this is always up to the veterinarian's discretion. The veterinarian does not have to allow their assistant to do any of this if they don't feel that that's appropriate, okay?
And we also have to remember that we're including in this veterinary technicians that haven't passed the boards yet, right?
They would be assistants.
So it's not just an 18-year-old that came out of high school. Skilled.
Yeah, and this is, Yeah, and so what we're doing with this exercise in this supervision is that this is under the immediate supervision, these are the minimum level of supervision required, right? So the minimum here is immediate, but when you go up to the other, like the baseline is direct, so that's a much broader area, and you can always go back to direct if it's not one of these enumerated tasks. We can add to this list too, or we can remove things. Just a draft suggestion at this point. Okay, so number one, administer pre-calculated doses of anesthesia or sedation. Induce, monitor, and maintain anesthesia and sedation, including recovery post-anesthesia and sedation. Remember that this is defined as immediate with a veterinarian with eyes and ears on the patient, okay?
In other words, it's just because you have a weight chart, and you have to visualize that you're pulling it up right. It's the sedative.
I don't know if you have to watch them that closely, but you have to be within eyes and ears of the patient.
You have to be available, readily available.
I mean, I guess you,
Jump in.
in practice, I could see a scenario where, you know, you're gloving up or whatever, and your back's to the patient, but you're still within that eye and ear shot because you can easily turn around. Like, you don't have to be, you could be in another room as long as you can see the patient.
So you're accessible to.
You're very, very accessible. Not, whereas direct supervision is on the premise. Whatever that means.
And they're not calculating the dosage.
Right, it's pre-calculated.
They are already advised of what they're going to
You got a weight chart, you pull up this much for that.
That's not it.
Well, it's a pre-calculated.
That would be considered pre-calculated.
Yeah, that's what I'm saying.
But calculating is not, so you're not.
I see what you're saying. Yeah.
Okay.
3, perform endotracheal intubation in non-emergency settings. 4, provide regional anesthesia, including paraverbal blocks, epidurals, local blocks. 5, suture, staple, and glue surgical skin incisions, gingival incisions, and skin lacerations. 6, insert arterial and central venous catheter. 7, place an abdominal, thoracic, or percutaneous endoscopic gastronomy tube. 8, place gastric, nasogastric, and nasoesophageal tubes. 9, place epidural, intraosseous, and nasal catheters. And 10, aspirate fluids from a body cavity or organ. So all this and pieces. Any questions, comments, concerns so far?
Yes. I'm not too gung-ho about assistants placing thoracic and endoscopic gastroscopy tubes, or the nasogastric, nasoesophageal tubes. I guess I'm not too anxious to have the tube placed into the trachea by accident and a bunch of barium it happens. I think it's less likely with a registered veterinary technician.
What about veterinarians who don't have an RVT and have had an assistant for 30 years? That if you excluded this,
Yes.
then they would not be able to practice.
We've had that come up, you know, and I don't,
And it's immediate, so they have
I
to.
see
right
what
there.
you're saying, and I think, quite honestly, even 10 years ago, that was a valid point. I think we're getting to a position where there's enough, I know there's a shortage of everything. There's a shortage of drive-through McDonald's people, but the bottom line is there's enough AVMA accredited graduates, licensed technicians. In 2025, if you don't have one of those, you've got a problem. in 1992, maybe not. I'm a little biased here, but because of my background.
Well,
But I think we've been confronting this for my 15 years on the board. The technicians have been begging for a delineation between them and the assistants and having their education recognized. And I think we got to address it now. If not now, when?
That would be a statutory change.
That would be what?
This rule is attempting to do that also.
Well, I mean, yeah, this rule attempts to do that,
Right.
in some capacity.
Like you said, you knew it was going to get here. So I think,
Sitting around the table, how many of us have assistants? I don't care if they've worked with you for 20 years or 2 years, that with you in the same room saying, hey, how many of these things would you have those assistants doing? I'm not talking technicians, I'm talking assistants. And I'm looking down here going, I'm not gonna have an assistant do an epidural for me. I mean, that's just not gonna happen. I mean, maybe I have undertrained these people, but holy cow.
when I saw the list, there was an awful lot on the assistant list that took me by surprise. And I tried to look at it as I've got good RVTs that I know what I will and won't let them do. And there's some things on this list I may want to do myself and not have them do. But the assistants, I definitely wouldn't have them do. But it doesn't mean I have to let them do it.
Right.
And so trying to make that happen in my mind that, because I don't know what your practice has as an assistant that has been with you. So your question is great. That's what I try to put my mind up to is I don't want to stop someone who has somebody from doing some of these things, even though I'm not gonna let my assistants do a
And
lot of things.
this does not give an assistant the power to go to the veterinarian and say, this says you have to let me do this under immediate supervision. That's not at all what this says. This is just, the guidance is that this is the minimum level of supervision, eyes and ears on, if they want to use their discretion and delegate these tasks. If it's not happening, it's probably not even an issue, right? Like, most of you aren't gonna be having an assistant do this. But for those few that do.
And under today's law, they can do it under direct supervision.
Correct.
All these things.
Well, and
Currently, so we're shifting that to immediate.
Yes.
Right. Or prohibited.
Fair. Okay, all right.
there's the collection of 3 here, too, that you mentioned with the tubes, with an insert arterial central venous catheter. If you think about the types of practices that are gonna be doing those 3 things, these certainly don't have, I mean, most of those require 24-hour watch. And a 24-hour watch facility will not have veterinary assistants do those things. So, I mean, right? So
It's not giving them license to go out and do all of these things. Like Gary said, right now, veterinarians can delegate these tasks under direct supervision where they don't even have to have their eyes and ears available to the patient, right? This limits the scope for the level of supervision to immediate. It hopefully protects the veterinarian, the assistant, and the patient by increasing the level of supervision, and helps some of those folks that don't have RVTs, because I know that there are some out there. 'Cause they called when we brought the
Right.
dear
But-
colleague that are
But
out,
they're probably
right?
not doing these. So
Correct.
if this would make us all feel better, we've got a few that are blocked out anyway. Could we block those 3 out? Material.
So when you say those places aren't gonna be having the assistant do them
those.
anyway?
Yeah, because these are more of like tertiary care
Okay.
stuff. Because you can't just leave these things for 8 hours till you come back the next day. I mean, maybe nasal gastric, but like the vet can still do that, or the tech can still.
The other thing.
But even
is-
if the assistant places it under immediate and then that higher level of care is still present for that 8 hours with the tech or vet, right?
But I guess I'm saying is, in that situation, the number of people that we're taking this task away from is probably really low. So maybe to make everyone feel better, we just make that a prohibited task.
And you're gonna block what, the bottom 5?
No, I was leaning more towards
8.
arterial and central venous catheter, place peg tube, and the gastric tubes, those 3.
So 6, 7, and 8.
Yeah, I was on the chart
Yeah.
there on that.
So it's not the
Yes.
bottom 5, it's the 3 above the last 2.
Well, but Paul doesn't
What about
like the last one.
But assistocentesis,
So you're leaving,
I think-
No, not a cysto, but a
you're leaving
thoraco.
6,
I mean,
7, and 8 off,
it's listed in there.
right?
no, I see cysto, but the others, you can poke some important stuff.
Yeah.
Yeah.
That's
Same.
fine, I think she was just saying the 3 that she was referencing.
Well, I was adding to
Yeah,
her
Yeah,
reference.
yeah. So do you want to prohibit the last 2 on that page? Of the chart, which would be 9 and 10 in section 6.
My only issue with the last one, I mean, of not blocking it out is that I think there are well-trained veterinary systems that can do assistocentesis.
Absolutely.
Right, but thoracocentesis
yes, I
and
know, I-
abdominocentesis.
But if we block it off, then they no longer, the assistants can no longer do it. Under,
But it's like Paul was saying too. We're changing this based on this day and age. I will guarantee you, back before any of these people were around, there was a lot of assistants doing a lot of things, because that's all they had. The vet didn't want to do it. We gotta look to the future here a little bit too.
In 20 years, they'll.
Well, we don't want to do this every 2 years either.
No, but in 10, I think that's probably 5 to 10 is appropriate because we're changing so much.
But in 10, can't we just drop thoracocentesis and abdominocentesis and leave cystocentesis? I don't have a problem with an assistant doing cystocentesis.
I'm all fight the system.
I don't want a cat with pleural effusion on a prep room table while I'm in surgery and have an assistant. I'm not even sure there's that many RVTs I'm comfortable with open chest cavity.
No offense.
Which again, you're.
Yeah, well, that's
We don't want to do that anyway.
But that's why you are the
Well, that's one
supervisor
of the
deciding
things
that.
teach.
Right. But I think there's nothing wrong with removing thoracocentesis and abdominocentesis. And the placement of these central venous catheters and, you know, I don't want a veterinarian in surgery telling an assistant that dog's bloated, put the stomach tube down. Dude, take your gloves off and put it down and then let them care for him. See what I'm saying? I know it's a bit tempting. I mean, I had some on-the-job trained assistants that were 25 years, they could put that stomach tube in. But how do you decide? You as the veterinarian can use your discretion. I wouldn't, if we're gonna do a laundry list, I would leave those out. I don't want somebody saying, hey, I can do this because it says so. Or let's say, you know, you're trying to give barium to a cat and you tell your assistant to put a nasoesophageal tube down and administer 20 cc's of barium to take a contrast study.
You can have a good bronchial study.
Yeah, and you have a dead cat. And then
And you'll lose your-
then we call
And you
the,
could, yeah, you could lose your license in front of us.
then we call the
because
veterinarian.
Why did you allow this assistant to do that?
Veterinarian comes here and it's a come to Jesus meeting. Why did you let that person do that? Well, it says right here they can't.
Right.
I don't want that.
Okay, I think Dr. Shipman has some comments on this one.
Yeah, so thanks, Brittany. I do think I want to make sure we're considering the implications in large animal as well. So whether that's an NG tube in a horse and refluxing it, or it's a trocar or a cow that's not quite abdominocentesis, but we are accessing the abdomen, or even a thoracocentesis just for diagnostics in equine. So I just want to make sure we're not putting ourselves in a corner for some tasks that may currently being done, even under the direct supervision of a veterinarian, where because remember, if we strike them from the list altogether, we're back to direct unless we prohibit, right? So we have, those are the two options, are prohibit, immediate, or direct for this. And this list was composed and put together to add an additional layer of scrutiny to this, but also with the mindfulness of trying to delegate back to that veterinarian in their professional judgment.
So again, in my head, even though it looks like we are allowing more, we're actually restricting it a little bit more than current,
But maybe not enough.
but maybe not enough.
I mean, we're not
Correct.
disallowing registered veterinary technicians from doing this. We're disallowing non-registered assistants from doing this. And I think that needs to be the focus. I mean, I've been in practice 46 years, and I haven't had a single assistant that I'd turn loose doing this stuff, even with me on the other side of the room.
But I think what Kyle is saying, if that's your feeling, we have to put it in as, you can't do it, because right now they can do it under direct supervision.
That's what I want to do.
So, okay, so that's, I just want to make sure.
I said I blocked off the last 5, but I mean, but that's
And put them up into the prohibited.
correct.
Okay, I just want to make sure we know what we're saying.
So you want to block off,
Well, I'm looking at this chart, I guess.
okay.
Not what.
So it would be 6, 7, 8, 9, and 10. Or for 10, it would just be thoracentesis and abdominal.
Yeah, I think doing cystos is.
Correct.
I mean, I could give them to, this isn't saying you can't give an epidural, it's saying you can't put in an epidural catheter, right? Epidural, interosseous, and nasal catheters. Are you thinking
Yeah, we're leaving that alone.
that's?
Okay, so
on-
skip 9.
Okay,
Are you okay with that?
Yeah.
okay.
But we're taking thoracocentesis and abdominocentesis out of 10.
Yeah.
And then we're leaving 11, 12, and 13. We haven't got there.
We haven't gotten there yet.
Okay. All right.
And again, when we say taking them out, then that means putting them up above
To the prohibited.
to the prohibited.
Yeah.
And just for clarification, the language here is that this rule is prohibiting the veterinarian from delegating the task
Correct.
to the assistant.
And we need that.
And there's a reason why it's written this way.
And we need that because not all veterinarians are as astute as Dr. Rodenbacher in recognizing what their lay staff can and cannot do.
Did you say stupid or stupid?
No, it's.
Okay, number 11. Perform ocular tonometry, Schirmer test, tear test, and fluorescein stain application. 12,
I'm okay with that.
perform dental procedures, including but not limited to removal of calculus, soft deposits, plaque, and stains, smoothing, filing, and polishing of teeth, and simple, non-surgical manual extraction of a single rooted tooth, performed without elevation or sectioning of the tooth or surrounding bone. comments, questions, concerns?
Did you
I think that's all right on
perform
the teeth.
ultrasonography? or is that
If you're
something-
doing a dental and the tooth is flopping in the breeze, that's not really an extraction, it's like, get it out of your way and.
Currently it is, right, Paul?
Yes.
That's further down.
That's the
Yeah.
problem.
This one.
Yeah, because we're only doing the
So-
Oh, I see.
We had a board chair for a number of years that would grill assistants. So when you're doing this dental and the tooth is wiggling, are you taking it out? He was trying to trap him. He's not on the board anymore, so.
Is he dead?
No,
Okay, I'm trying to figure out which one it was.
He's dead.
he was the board chair for a while.
Okay, 13. Collect, prepare, and administer blood or blood component for transfusion or blood banking purposes. 14, apply casts, splints, or slings for the immobilization of fractures. 15, administer intraperitoneal injections. And 16, administer intravenous injections into uncatheterized veins.
Get rid of casts.
Yeah,
I'm not
that's,
gung ho about casts being put on.
you can splinter them.
I'm a little bit shaky even on the splint if it's put on too tight and you wind up with a leg amputated. But I'm less concerned about splints and slings. I'm a little more concerned about casts. I've reviewed, I can't tell you how many cases where casts applied by the veterinarian have been, I won't use the word, have been a disaster. And that's with a licensed veterinarian. Casts scare me.
Cast and splints.
Splints.
Yeah.
Temporary.
We do splints
What you're gonna
also.
do.
We're talking about immediate, not the temporary one.
You know,
This,
the definition of splint can be, and I don't have a problem with the veterinary assistant putting a padded Robert Jones bandage on there. I don't have a big problem with that. And I wonder if we could take out casts and splints and apply bandages and slings for immobilization. What do you think of that? You know, if you got a leg flopping in the breeze and you're in surgery, you can tell your assistants, look, get a bunch of cotton and put a padded bandage on that thing till I can get to it.
yeah, it's
I think
pretty
that's-
hard to do permanent damage on it with the
Right.
Bobby Jones.
So if you allow bandages and slings, you know, I'm okay with that. But casts and splints, I'm a little bit weary of. Not as much splints, but I'm definitely weary of casts.
What was your words? I like your words. What were they again?
Apply bandages and slings for immobilization of fractures. I'm okay with that.
I agree.
Jerry, you're looking at me like you're not sure.
No, I was just trying to. think
And you
through it.
could-
I think it's okay.
You could actually apply bandages and slings for the temporary.
Nope, that's a different
Okay.
section.
That's below.
Because this is immediate supervision,
Okay, all right, I got you.
okay?
And that's applying something that is gonna go home, that is a treatment that you may not see for a week or 10 days. So you need to know that it's been applied effectively and it's not gonna restrict blood flow and cause a limb to fall off.
That's, there again, someone could put a bandage on too tight, I'm sure that happens, but
Yeah.
I think it's less likely with a bandage and a sling than a cast or a splint to wind up losing a limb.
And it still goes back to all your care, and if somebody's repeatedly doing the wrong thing, then the client will report them and.
Standard of care.
Mhm.
I mean, definitely wanting to strike CAS.
I think cast and splint should be both.
I agree. But I think, and if you actually said padded bandage or something to indicate that
Right.
you're not just throwing an elasticon wrap on there.
I didn't want to get too detailed.
I understand.
Padded bandage and apply application of a padded bandage and a sling, I'm okay with that.
I am too. Are we good with that?
So Dr. Shipman wanted to, or he asked if vet students are considered veterinary assistants.
It what?
Vet students. And so
They're less.
they're less than that.
No, they don't have any experience at all.
Okay,
That's
there.
But you can,
Well, the third year.
yeah.
It depends on whether,
It
yeah,
depends.
okay, the way,
You could have someone that's been an assistant in your practice for 8 years and decide, hey, I'm gonna apply to vet school. They're gonna be good.
okay, it
Right.
depends on when you say student, what level. And the way they're doing it now, you know, by the time you get, even in junior year, you're doing a lot of clinics.
Does he want you to put specifically the word student, lump it with assistants?
no, because they are assistants.
No.
I mean, they're not.
He's just
registered veterinary
reminding us
technicians.
that
We
they
don't want to
are,
limit.
and that we're
Yeah.
eliminating
Things.
allowing a veterinary student to do these things because they are an assistant.
Right.
Right? Is that the concept?
Yeah, that's the concern is I don't want to artificially, and even in the educational institutional setting, I don't want to artificially prohibit them because they are in that sense still a veterinary assistant. And so by putting things on the prohibited list, even under immediate supervision, they may not be able to demonstrate those skills because of that prohibition. Not to try to add another wrinkle. I want to make sure we're.
You added another wrinkle.
I know.
And under the definition of extern, which would be like veterinary students in like their third year or fourth year, they can work under the direct supervision of the vet.
So they're covered under the earlier definition.
Only if they're in their fourth year.
That's okay. I'm all right with that.
We don't want to get, we don't want to get the colleges that are in medicine and limit them to.
But we protected them as earlier in our process, we exempted them from requiring a license.
Say that again?
Yeah,
Yeah. The
we did.
people at the university have one. Well, they're not under our control because they don't have a license, right?
If they don't have a license, then yeah, but if they did, you can still. So the issue though is more that these externs or students aren't necessarily at the school.
Yeah, I think, yeah. There's a difference. There is a
Question,
difference.
Dr. Bogart from the audience.
Please.
So from an educational standpoint, the student should also be covered under the AVMA guidelines for the accreditation of the school. And there's statutes in there that says during the educational process, they are allowed to act as under the supervision of an instructor, or that instructor becomes whoever's in charge of their clinicals. So same thing with the technician round, when they go out on those externships, they are under the direct supervision of a DVM or an RVT and can practice as if they are a credentialed technician in the education process, as long as they are enrolled and covered by the school. So that shouldn't be unless you have a vet student who is working this summer in a practice, then they would be an employee of the practice at whatever that designation, not a student.
That makes a lot of
So,
sense.
but the AVMA does have very strict wording for the educational programs on what they are allowed to do in the educational program skill wise.
Okay.
So,
And because the ABMA guidelines that she's referring to are not in the Practice Act or our rules, we may have to
reference.
revisit that and reference later specifically for students.
And
I think that's
For
the
best
point
students
is
and
our
faculty.
our rule doesn't contemplate what she just said, and I think that's the important piece that we need to be thinking about if we want to make sure the educational process is still protected, as well as for veterinarians that are not licensed at the university. At some point, they have to be considered something, even though they're not required to have a license. So, what are they?
How we're doing this?
Okay, as the dust settles, where does this leave us on this?
So students, by definition, I thought earlier in the Practice Act, their externships were not required to be licensed,
They're not.
because they're not licensed, but
Yeah,
they're,
I think that's,
but,
she's saying they're protected.
but they're, I would think that protects them. And protects us from allowing them to do things.
I think Brittany could come up with language to make sure that what you're currently working on doesn't exclude a student from doing what you want.
Well, and certainly we could
But figure out how
add,
to do that, I can't do this.
we add a statement,
But
exemption.
you know the mindset.
Yeah, I know what you
Well, we
want.
can, but I can't articulate it in my brain right now
Right.
to add it.
But
And,
you've got a notation that
yeah.
we're gonna have to address it.
Mhm.
Okay.
And again, we're not limiting assistants or RVTs or students in any manner inconsistent with the Practice Act. We are expressly telling veterinarians what the minimum supervision is required if they choose to delegate these tasks to certain individuals.
Yeah, I just think when you say may not do these things, you just have to be clear that students can still do them if they're a
Oh,
student or
yeah,
whatever, we can figure out the wording.
These are under direct supervision, is that the new word?
Immediate.
Immediate.
That's what we're talking about now, which means in the room.
What about, what's your thoughts on
Side,
number
line of sight.
16 then? Do an IV injection.
We're on our way there.
I already read these.
Yeah.
So we struck casts and splits.
Yep.
Good. You guys are okay with intraperitoneal injections?
I think this is getting us back to farm work, right?
But you're okay with that? No. I don't have a huge issue with that.
Send anyone out
No,
without me out there to do it.
right,
If I'm there.
but it's under immediate supervision.
Right, you're right.
And it's the same thing, occasionally, that's done for euthanasia and rabbits and gerbils and hamsters and whatever. I try to hit those cephalic veins in those hamsters. Never was able to get it done.
Administer intravenous injections into uncatheterized veins. Immediate supervision.
That's okay.
Okay, so we're done with the section on assistants. Assistants are prohibited from doing anything under indirect supervision. So that's why that's left off here. So under the Practice Act, they can't do anything under that. So paragraph G is, we're moving on to RVTs. Subject to Practice Act of paragraph C and H of this section, licensed veterinarians may delegate other tasks to registered veterinary technicians under indirect or direct supervision. Did I correct that? That's the base. So then in eliminating some of that. H, licensed veterinarians may delegate the following tasks to registered veterinary technicians only under direct supervision. 1, perform minimally invasive scope assisted procedures. 2, administer pre-calculated doses of euthanasia solution. 3, administer pre-calculated doses of anesthesia or sedation. 4, induce, monitor, and maintain anesthesia and sedation, including recovery post-anesthesia and sedation. 5, perform endotracheal intubation in non-emergency settings. 6, provide regional anesthesia, including paravertebral blocks, epidurals, local blocks. 5, place subcutaneous tubes or drains. Any questions with 1 through 7 or comments or concerns or anything like that?
Yeah, the whole subcutaneous tube and drain thing is kind of bizarre. Certainly they can administer subcutaneous fluids, so can the assistants.
So
That
we
can-
just prohibited veterinarians from delegating that to assistants, so.
Right, but subcutaneous tubes, that's not, realistically, that's not done much at all. It's usually just an 18 gauge needle hooked up to an IV bag and you're slipping it onto the skin and administering fluids. That's not the same thing as a subcutaneous.
I mean, I would think that's if you're draining an abscess or something, and you're
Yeah.
wanting to place a drain, which frankly is pretty much a surgical procedure.
Yes.
Yeah, we just didn't address sub-Q fluids in this anywhere. It just came to mind that we never mentioned administering subcutaneous fluids. We never mentioned it up in the assistant section,
And that's super common.
and it's very common.
It's kind of hard to screw that up.
Right.
Well, but it needs to be placed somewhere.
Well, I was
So
just saying, but
that-
you have
okay,
to place
so-
everything that they
So
could
would that
ever
be,
do.
would you want that under immediate supervision? Sub-Q fluids?
No,
No.
no.
So that's why it's not listed on here,
Okay.
because it can be delegated under direct supervision.
Okay,
Okay, fair enough.
I just want to make sure that's covered because it's done every day.
But I
Yeah.
agree with Paul, this placing sub-Q drains and tubes is kind of weird.
Yeah, well, it's from the AADSD, those people are. Sorry, I didn't say it. Is this on tape?
No.
Yeah, they watch.
Right.
Hey, Dr. Beth.
We want to cross this off? Do you think we want to cross that off? But that's, if you said surgical procedure, then that's just one area.
I was gonna say, can we ask the
Comments
gallery if
from
they
over there?
are having thoughts on this one?
I feel like that's a slippery slope, and at least the language isn't concise. So as you have it stated, to me, that's a surgical procedure that requires a percutaneous incision.
That should be done by the.
I think this should be done by a veterinarian.
Yay.
I mean, we can
Didn't
get
want to
into,
offend you, but that's
Yeah,
why.
Yeah.
exactly, we don't wanna
yeah,
take things away.
that's
from
the
you.
language,
If the hole's
that's,
already there and you're placing a pin rose, it's not a big deal.
yeah, yeah.
But
If you're-
you're actually placing.
Okay, so I am going to just strike it from here and not create a prohibited list because she's saying that that's just surgery and surgery is already prohibited.
That's number 7, right?
Yes,
All right.
but
But
going back to, going back to paragraph E, the licensed veterinarians are prohibited from delegating the following tasks to veterinary assistants: subcutaneous tube or drain placement and minimally invasive scope assisted procedures. I mean, should we just strike that as surgery anyway, because it's already
Yeah.
prohibited?
Should that other one be an
E1.
you guys want E1?
E1.
Are we striking it or what?
Take
taking it out because it doesn't even
Because it's
need to
just
be there
surgery,
because it is for surgery.
All right, okay. I can go okay with that.
I know, I was just.
Well, you get messages a long time. Okay.
From Spain. Okay, so going back to the RBT. No, wait, I want to stay on E1 and 2, just real quick. So the minimally invasive scope assisted procedures. I mean, okay, obviously for assistance, we're gonna prohibit that, right?
Right.
But for an RBT, moving forward, are you gonna allow it? Because it's on here.
So we strike at E1 and 2.
No, well, no. Not, I don't know yet.
We're talking about that.
I mean,
Because we're under, for RBTs, we're allowing the minimally invasive. I might not have said it yet, but it's on here.
Yeah, it's on direct. Oh, it's just number 1. Sorry. It's okay. I have you. Another bite you.
Okay, so the reason I'm asking, for RBTs, is it okay performing minimally invasive scope assisted procedures under direct supervision?
Yes.
Yes, okay. Then I think I'm gonna leave it to be expressly prohibited like that for the assistant and not just lump it into that surgery category.
Good call.
Everybody?
Yeah.
Okay. Cool. Okay. So H8, direct supervision again, for RBTs. Suture, staple, and glue surgical skin incisions, gingival incisions, and skin lacerations.
okay.
9, insert arterial and central venous catheter. 10, place an abdominal, I can't, it's not the abdominal, it's not abdominal,
Just say belly.
thoracic or percutaneous endoscopic gastrotomy tubes. Place gastric, nasogastric, and nasoesophageal tubes.
You guys okay with doing all those things?
Yeah, we do them currently.
I do have a quick question. For the central line and stuff, can we include cut down?
Yes, when you talk about cut downs.
Because in large animals, you mainly can't put, especially in Korea, you cannot put a catheter in without cutting down. In most jugular catheters, you need to do a cut down. That's technically considered surgery right now.
That would fall under the definition of surgery.
But it's actually, you're just making a nick in the skin to place the catheter. And a lot of times you can't place it without it.
Nor is it
I
recommended.
think that's a skin.
It depends, yeah. When you talk about large, like the alpacas and Koreas, you can't get through it without cutting down.
I never had one.
Yeah, even doing a cephalic.
And when you talk about cut downs, we also need to include venous cut downs during CPR and things like that.
Well, that, we're kind of covered by allowing, it just says insert. Insert arterial and central venous catheters.
So that's.
I think we could expound upon that to mean a small incision for a cut down is part of the insertion process.
That's what we're hoping, yeah.
So does that need to be in a definition or does that need to be just in here?
We can amend it, the catheter placement to include.
Including cut down.
I think you
Thank
just could add that terminology.
It's a gray area that we'd like cleared up.
you could put in there, insert arterial and central venous catheter with or without cut downs as needed, or with or without cut downs.
Or you could just put the catheter in, bend it over and go up through. I think
Thank you,
it,
John.
I think it needs to be put in. Once again, I think Paul's wording is, that covers it then.
He's such a verbose guy.
Is that just for, number 9?
Insert arterial and central venous catheter.
You guys mentioned one other,
Venous cut down.
Yeah.
Particularly during CPR, because the
Right.
patient is technically deceased.
Tangentially, if we're talking about cut downs, we just discussed placement of drain, right? If we can suture and we can do a cut down, where does that leave us with drain placement? I'm not saying that we shouldn't be able to do cut downs, I think we should, but
Well, you just referenced a cut down as no more than a nick in the skin, basically.
Correct.
And so that is not how you would place a Penrose drain
Correct.
with a nick in the skin. So I think we're talking about separate things.
so if there's, in the case that we're discussing, if there's a laceration when placing a Penrose drain, I guess should we put out placement of drains altogether or placement of drains that includes surgical incision?
Drains restrained. Drains restrained.
Oh, so that is now under
DBM only.
Okay.
But like for a central line, it literally is a 10-blade skin nick, just so you can pass the dilator.
Correct.
Yeah.
Okay.
No, sorry, that was my question, because like in ER, that's would be something our doctors would be fine with us doing, is like placing a Penrose as when we're helping close the laceration. Because it's literally like a suture or two under immediate supervision.
While they're repairing the laceration.
Or in conjunction, like, yeah.
Well, so the way that we have, if you go back to 6,
assisting,
this acting as a surgical assistant. Yeah, so 6, C1, so veterinarians are prohibited from delegating the following tasks to non-veterinarians, and one is surgery, except when acting as a surgical assistant to a veterinarian. So you would probably be doing all of that with a veterinarian, right?
Yeah.
The drain.
I mean, and generally is not the veterinarian determining whether a drain is needed or not.
Yeah, the veterinarian prescribes the drain, right,
Right.
and then we're surgically assisting. Is that what
And
you're
its
saying?
placement.
Yes, but then I was like, those two are contradictory, if it says we can't place drains.
Yeah.
We just need to cut.
Unilateral. Here, it sounds like you're in a team effort assisting.
Yeah, you're not just going and placing a drain.
Yeah, I
Yeah.
think, well, no,
Yeah,
any of the things we can do are just us decisions, they're all prescribed by a doctor.
Yeah.
Correct.
I'm not trying to be
We just didn't
argumentative,
want
I'm
there to
sorry.
be
Well, you are.
I work in ER, yeah, you have to be pushy.
So can we say that statement about serving under the surgical assistant saves them, protects them when they're placing a Penrose as the doctor is physically fixing the laceration repair? That we don't have to mess with the fact that we just took drains out, we can say that falls under that, and we can look at that.
Well, that was, wasn't that subcutaneous drains anyway?
It's a-
All the results.
Okay. Is it technically an incision or,
oh,
for the?
For Penrose,
It's usually pretty open.
it's already open.
That your drain has to.
Yeah,
Yeah, you have to.
We've already said they can staple and suture it up. But the decision to put a Penrose drain in should be the veterinarian and said, hey, put one in there and fill it up.
Yes.
But they're saying they would need to make a decision in order to place that thing.
No, we would need
No.
to suture.
It was, huh? What do you say?
We don't need to make an
Hello.
incision to place Penrose.
You just waving?
No, you will have to make a secondary incision to place a Penrose drain for the exit
That's,
of the,
that's what I'm.
because you're not supposed to use the same wood bed. Yeah,
That's
so
right.
it would be veterinary,
So-
yeah.
Or you got to incision that one, just run it out the back.
Let's finalize this.
I know what you're
talking
talking.
I think it should fall under
If it's a vertical and stitch,
the.
Assistant of the surgeon. Right.
Yeah.
I just want to do a cut down on a deceased dog that didn't see CPR on.
Isn't that technically part of necropsy, if it's already dead?
So we had this discussion and that the definition of surgery that we're adopting from the AAVSB would include living or deceased animals. A necropsy would be surgery.
We are removing things and cutting.
I'm not gonna complain about that. Although I think it's crazy to think of necropsy surgery.
Well, we're allowing it. The techs and assistants to do it under this anyway, so. Okay, 12, place epidural, intraosseous, and nasal catheters. 13, aspirate fluids from a body cavity or organ. That would be the centesis, thoracentesis, and abdominocentesis. Would you like to strike the thoracentesis or abdominocentesis in this one too, or? Because we could really just put centesis in there.
Yeah, I was gonna get back to that.
Oh, sorry.
What do you guys do?
We
Education
currently-
wise.
So I can speak for our experience. I've been in vet med for 26 years and that's been ER and critical care. That's something that we can do safely. As an RVT, we have experience with anatomy and physiology. We know the proper, aspiration points, those types of things. Definitely don't think it's something that an assistant should be permitted to do even under immediate supervision.
I would agree. It's also on the skills list for BTS and ECT.
Yeah.
Those are required.
Yeah.
Good point.
Yeah.
So all
That's
three of them?
good for
Or RVTs.
Yeah.
All three of them are good for RVT.
So we're gonna leave that alone, it's good. Good
I'm glad we
insight.
handled it properly for the assistant.
14, monitor an EKG, blood pressure, carbon dioxide, and blood oxygen saturation. Perform ocular tonometry, say that right, but you know what I mean. Sherman tear test and fluorescein stain application. 16, perform dental procedures, including but not limited to removal of calculus, soft deposits, plaque, and stains, smoothing, filing, and polishing teeth, and simple non-surgical manual extraction of single rooted tooth performed without elevation or section of the tooth or surrounding bone. 17, collect, prepare, and administer blood or blood component or transfusion for blood banking purposes. Like cast splints and slings for the immobilization of fractures. And 19, administer immunizations, including rabies vaccines. Because that's statutory. Just so you know.
In the law.
When they changed it a few years ago.
So for
Two separate
18,
places, one said yes and one said no.
18, applying cast, splints, and slings for the immobilization of fractures. Do we want to limit that more with the cast? Dr. Clemente, you're concerned about veterinarians.
I think our technicians would agree that that's not something that we have done in schools or taught.
I was taught how to place cast and splints. I also currently do that as the director of nursing within my hospital group.
It is a critical skill that we're.
Really?
Yeah, it's actually a core skill.
It's
To put on a fiberglass cap.
It's knowledge base for fiberglass. All other splints, slings, and bandaging is required. Hands-on required. It can be used on a model, it doesn't have to be live animal.
And
Wow.
CBTA has delineated that it's a skill that we need to learn.
Casting is a optional required, but you have to know the knowledge base of application and removal.
And how
I realize that we're coming from knowing veterinarians that have improperly placed
Oh, you have a whole different perspective.
Splints, casts, I mean, where you end up losing a limb because of,
Sure.
preventing blood flow to the distal part of the limb and that type of thing. And so it's not any level of shock of what you're trained to do. It's just that you've got trained veterinarians and I'm sure trained technicians, sadly, that are going to improperly place a splint or a cast at some point.
And I think it's also
It happens.
mentioned that RVTs are not created equally, just like as veterinarians likely are not created equally.
They're not one.
Except for those of us
Created
around this
equally.
table.
Yes.
You
I
know,
mean, we have some RVTs that are really skilled and some that,
created.
Oh,
Yeah.
really?
Like, there's a bad.
That's what we're on this board.
So anyway,
I have a
but it
question.
sounds like that's okay.
Well, I have a question because I'm not in this world at all, but if you apply a cast or a splint, would your veterinarian come check it?
so under a direct super, as you're indicating direct supervision, ideally they should.
Yeah,
So even
that
when
would
I
be-
suture a wound, I say, come check my suture sore, like,
That would fall under the standard of care then, right?
Yeah.
That the veterinarian, who's ultimately responsible for the patient, should be checking it. And so if you have a veterinarian who's not checking it, then that's the problem, not just the way the cast was put on, but that the veterinarian didn't take that responsibility.
right.
So the fact that it's a
Of
direct
confirming.
supervision gives me a little bit more
Right.
comfort in leaving that in there for registered vet techs.
And if it's a core procedure they have to know how to do. Yeah.
We're not.
Okay, any other questions, comments, concerns about section 6?
So on your chart, were there some additional things on your chart, like lasers and things? Are we gonna get to that next?
No. Because technically, the way the statute is written, those are things that can already be done. If you want to go through the chart and look at some of the things under direct supervision that you think should be, or indirect supervision that should be direct supervision, we can. Otherwise, it would be like baseline that those would be, like that's the most liberal
So-
part of the.
So the subcutaneous fluid thing that I was talking about is actually covered theoretically under administer intramuscular and subcutaneous injections. So theoretically, we're covered.
Yeah, so this chart is more for you guys to work through this exercise. I know Dr. Shipman would, in the future, we would like to be able to have something like this in place that you guys can print out and hang in your clinics as a reference sheet. But we chose not to enumerate all of the things that can be performed under indirect supervision. In the rule, the proposed rule.
Was there something, did I read something about radiography tax raise that I missed that.
Yeah,
It's in there.
Was it in the chart? somewhere?
It's, on your chart, it's on page 2, the third one down.
Oh, okay, there you go.
so veterinary assistants under the statute can do things under direct supervision, right? So what we put, there's a that first paragraph is that essentially unless otherwise stated, the veterinarian can delegate under direct supervision. We enumerated the immediate supervision list or the prohibited list because it's a change. It's a deviation from that direct. And the same thing with the indirect.
Okay. I understand.
Okay.
Ready, just real quick. At the risk of reopening a can of worms, I'm thinking back to our conversations about teeth floating horses.
I knew you were gonna go there.
And
When
so-
it says smoothing teeth, I was hoping no one else would notice that.
Yes, so under, this is suggesting that RVTs could not, under indirect supervision, smooth, file, or polish. That's currently written, so I didn't know if you wanted to actually do that, or would you allow an RVT to go to a farm without the veterinarian being there and do those things?
The RVTs are saying no.
How many RVTs would like to float teeth on a horse anyhow?
By ourselves? None.
We need you.
Assist, yes. Be there, yes. By yourselves, absolutely not. They're very
There's
sue
no-
happy in the horse world. No, thank you.
There's no,
They're sue happy in the horse world, and no, thank you.
There's two what?
I said they're sue happy. They like to sue you, the horse
Oh,
world.
okay.
So both things.
We don't make enough money for lawyers, no.
Right.
Both things are under direct supervision. The dental part is under direct supervision anyway. So we should be covered.
Yeah, I mean, just currently under today's law, they could do it under indirect, just to restrict that. I just want to make sure we do that consciously.
The way it is on our flow chart, it's currently it says direct. On this chart.
but you mean, that's just at the racetrack though, isn't it?
Well,
Where-
I'm just talking about, not at the racetrack, that's been, the General Assembly spoke on that, so.
Don't bring up
There-
that trauma.
It was emotional, wasn't it?
We can't do anything about the racetrack crap.
We're losing you.
So like, the legislature, change that, they did,
It was here.
deal with the problems as they come up next year.
Where are we?
Okay.
Need another break or
We need another
something?
break, so we're done with Rule 5. That wasn't as painful as I thought, but
That's because we had good help.
we did.
Thank you.
We have more to go, but we could take another break and then start in on my PowerPoint.
Sounds fun.
So fun, which is.
We are on a recess. We are back.
Okay, I'm gonna share my screen to go over this PowerPoint. We've got two topics. Oh, here, hold on, sorry. Just a second.
Does that create a problem for you?
So the exercise that we just did was rulemaking. Now we're gonna talk about two topics that are actually in statute. The first topic, RVT supervision of vet assistants, is in the Practice Act. And then telemedicine is in Title 25, and it's the current law. So this is an exercise like we did last meeting with the VCPR. And I just want to let Dr. Shipman, if he's still on here, to know that I can't see the chat anymore, so if you're on here and you have something, you wanna jump in, just go ahead and jump in.
Sounds good. Thank you, Brittany.
So, under the Practice Act, the RVT, the Registered Veterinary Technician, means a veterinary technician registered under this article to work under the direct or indirect supervision of a licensed veterinarian. You guys already know that, right? We've actually just talked about that briefly. But what we want to talk about now is the veterinary assistant. And that the veterinary assistant is an individual who is not licensed veterinarian or a registered veterinary technician who performs certain tasks related to animal health care under the direct supervision of a licensed veterinarian or a registered veterinary technician. The definition of direct supervision in the Practice Act means a supervisor is readily available on the premises where the animal is being treated. This is not limited to a veterinarian. Indirect supervision means a supervising veterinarian is not on the premises, but, and then 1, 2, and 3, I'm not gonna read, because that's not the important part here. What? Okay. Continuing on with the Practice Act, a registered veterinary technician or veterinary assistant may not diagnose, prognose, prescribe medical or surgical treatment or perform as a surgeon. However, the registered veterinary technician may perform routine procedures defined by board rules while under the direct or indirect supervision of a licensed veterinarian. And this goes back to the statute we looked at earlier where the supervising veterinarian shall determine and is responsible for determining if the task should be delegated and are commensurate with the employee's training, experience, and skills. And the reason that I brought this up is because whether the veterinarian is delegating the task to the RVT or is allowing the RVT to supervise the veterinary assistant under direct supervision, it all goes back to the discretion of the veterinarian, okay? But the discussion part of this, after doing the exercise that we just did with adding immediate supervision of a licensed veterinarian for RVT or for vet techs, and then keeping other tasks under the direct supervision, which by definition would include, as it is today, it would include a veterinarian or an RVT. So the question for you guys to discuss is, do you have any interest in providing further clarification on this level of supervision? Are there things that you don't want an RVT to be directly supervising an assistant? So would you want to prohibit a veterinarian from delegating that level of supervision to an RVT?
You're talking about immediate?
No.
Or direct or indirect?
Right now, we're just talking about direct supervision. We may delete everything that we just talked about based off of this statute, but, and then the other thing to think about is is there any type of enhanced veterinary supervision you want to be explicit about? So, for instance, if the RVT is allowed to supervise the vet assistant under supervision, what level of supervision is required for that task of the veterinarian? So can they only directly supervise things that they can indirectly supervise or do without? It's complicated, okay? I know that.
So we're referring back to this again and deciding what's okay
We don't, no, right now we're just,
That's what I was.
you can reference that, but right now we're just looking at, awareness of the statute, okay? An RVT can provide direct supervision of veterinary assistant. So the question is, do you guys want to clarify that in any way? And is there some sort of enhanced supervision required by the veterinarian?
I'm assuming that the RVT can only supervise an assistant on stuff, on items that they are authorized to do. Is that what you're saying? In other words, you can't supervise, I wouldn't think you'd be able to supervise somebody if you're not authorized to do those procedures or whatever.
Sure, but an RVT is permitted to do essentially everything except surgery, diagnose, prognose, or prescribe.
So you have veterinary assistants that are already, what we just went through, already doing things that we have specified have to be under immediate supervision, which means veterinary. Correct.
Mhm.
Well,
Might not be.
We can delineate that.
when and if this rule comes in.
Right.
Yeah.
So we can delineate that in that I feel like registered veterinary technicians should be able to supervise assistants in those tasks that do not require immediate supervision by the veterinarian. Who reported that?
That's basically what I mean.
Well, but then you look at some of these, like veterinary assistant, tremor tear test and eye stain and all that. And when you look at veterinary assistant through the eyes of, it could be someone who went through technician school but hasn't passed the boards yet. I don't think a vet needs to be in the building while the technician supervises a tear test or an eye stain or stuff like that. Like, I feel like that starts to pull away
So you have a
some of
few,
this.
so maybe you have a few tasks that you assign to immediate veterinary supervision that you think that the registered tech could supervise.
I think that the best way to do this, if you are gonna want to limit the supervision in any way, is to create a list of things that the RVT is prohibited from supervising under direct supervision. Or
Because there'll be way less of those than ones we're allowed.
that too,
So,
but it's also easier to look at a chart and say, okay, these are 6 things that RVTs cannot supervise under direct supervision.
Yeah, I like that.
And the way it would be worded, just for clarification, is that the veterinarian is prohibited from delegating the RVT to supervise a veterinary assistant of the following.
Okay.
So you're gonna go into that assistant list and pick out the things you don't feel that a registered tech could adequately supervise an assistant.
Yeah.
Good.
And if you look at that chart off the top of your head, what things can you see right there that the RVT should not be providing direct supervision of?
Are we talking about direct and immediate?
Nope.
Immediate has to be a vet?
Under the definition that we just. It doesn't mean that they can't provide. It doesn't mean that they can't be in the room with them with the eyes and ears. But, so this is just the minimum amount of supervision. And right now, the statute says direct. So let's do direct now, and then if we want to move into immediate supervision, then we can, but that might change our definition of supervision that we just went over, of immediate supervision that we just went over.
It seems reasonable that they should be able, the RVTs should be able to supervise anything that we've listed for the assistance that is just direct.
I agree.
It's the immediate ones we've listed that we need to look at and make that determination, because right now it says veterinarians have to be in the same room. So we can lop off all the direct ones and just address the ones that are under immediate.
Really, if the veterinarian's in the room, just the veterinarian supervising. There's no delegation to the RVT, the RVT's in the room. So under immediate, the veterinarian's in the room, so there's no delegation to the RVT.
They can, you're in there, but the registered veterinary technician is the one that's actually guiding them through it. But that doesn't ruin the rule, though, right? Because you're in there anyway.
Because the definition of immediate supervision doesn't require the veterinarian to guide them in any way. It just says that they're within audible and visual range of the patient.
I mean, that's fine, but I still don't feel like I need to be in the building for them to do an eye stain.
Is that under immediate for the veterinary assistant?
Yeah. Or
Well-
like prepare blood.
Well, should we move a couple of those things over to direct for the assistant? You really only have a couple of things.
Yeah, that's true.
If you really, on this chart, you really only have about 4 or 5 things that are under immediate supervision that I would be comfortable allowing the RVT to supervise. I think administering anesthesia for assistants should be under immediate supervision. You know, inducing anesthesia, putting in endotracheal tubes. Most of what's on the immediate supervision list for assistants, I still feel the veterinarian needs to be.
It doesn't take too long to just go down that list of their veterinary assistant immediate, real quick.
Yeah, well, he just went through 4 of
Paul's
them.
doing that,
Yeah,
more or less, I think.
yeah. There's only 4 or 5 things that,
So which ones do you think could move into direct supervision?
I think you could move the tonometry, the ocular tonometry. I think you could move that from immediate to direct for the assistant.
We had one comment over here.
Hold on, Clarence.
I think the administering IV injections into uncatheterized vein could be
Okay.
one.
Hold on, can we go back to the eye testing real quick, please?
Yeah.
I can't follow what you guys are doing.
We're doing this flow chart, John.
I know, but I'm on the flow chart, you keep jumping
It's,
around.
we're on the second perform ocular tonometry right now. So
Okay, so all 3 of these things in this, you're cool with moving to direct supervision?
Tonometry,
The tear test and the stain.
right.
Okay, Dr. Pillman, what was the next one?
Then the second to the very last on page 3, administer IV injections into uncatheterized veins.
what about that?
Can we move that to direct?
for an assistant?
Yeah, because that would allow
Still
the
thinking about
RBT to supervise that
Instead of us having to.
instead of us.
Okay. Before we get too far, what was your question regarding?
Mostly clarifying whether, when we're talking about a veterinarian delegating to a technician with regard to supervision, is that veterinarian delegating the supervision? Or is that veterinarian providing additional supervision? So now you have a veterinarian and a technician, or is the technician taking on that responsibility of supervision? I feel like that would take care of your point that if a technician is stepping in and taking on that role of supervision from the doctor, then that doctor doesn't necessarily need to be there. Right. And we can leave those items under immediate supervision, because then that technician is immediately supervising.
Yeah, but immediate supervision automatically is defined as a veterinarian being within eye and earshot. So you would have to move it out of immediate, I think. Is that not correct? Everybody agree with that?
I don't think you guys should be responsible for an animal under anesthesia that's being performed by an assistant without a doctor being in the building.
I agree with that statement. I have an example that might help provide some clarification under the way this is written currently. So COVID, there was some times on overnight emergency ICU where there was not a doctor available. So we have ICU patients in the care overnights without a veterinarian directly in the building. Under indirect supervision, that veterinarian provided treatments that they approved under indirect supervision with an RBT providing direct supervision over a veterinary assistant to continue to provide hospitalized care to those patients. So that's how we currently utilize it, the way it is written. So it's not procedures, it's hospitalized care. It's giving medications, it's providing intravenous medications, it's doing blood glucoses, it's doing those types of things in the absence of a veterinarian.
Now, although that was dictated because of COVID,
Yes,
is that still going on?
yes,
Okay, so we tweaked the rule because we had to at one point, and now we're enjoying it enough that we're continuing it. Is that kind of what's happening?
not voluntarily. So in our particular group of practices, we do have some DVM attrition, and we have 24-hour facilities. So there are some evenings where there is not a doctor present in the building. The owner has informed consent. The owner has given consent for continued care under the guidance and supervision of an RBT, providing direct supervision to assistants under indirect guidelines provided by the DVM that is written out. And according to how it's written, that is still within the law.
We have the same thing, like our specialists keep their cases overnight. So it's me contacting a surgeon saying, hey, you're dischanged with your patient, them delegating back to me as a tech.
Correct.
This is what I want you to do, and I can either do that or I can have an assistant do that.
Correct.
Who's working under me.
In fact, it's gone so far that if we don't have an RBT available on overnights to provide that direct supervision through indirect clauses, we transfer those patients to a hospital that has indirect supervision or direct supervision of a veterinarian. So that's how it's being utilized in real life, how it's sitting right now.
So these are specialty centers that are not 24-hour ERs. They're,
We are 24 hours. We have an ER facility. Yeah, we're 24 hours. So
but you don't have a doctor there.
Sometimes of an evening, a doctor may have to leave at midnight because they're sick, or we couldn't get coverage because of whatever. We still have hospitalized patients. So we have to make sure there's an RBT in the building so that our assistants who are running ICU have the ability to continue to administer medications, because assistants aren't identified as being able to work under indirect supervision, but technicians are. And under this, technicians, if they're providing direct supervision of an assistant, can therefore give indirect guidelines from the veterinarian to the assistant as that direct intermediary.
So do you divert all other emergency calls?
Yes,
I mean, that's where I was going.
Yes,
with-
yes.
Our ICU.
it's just our ICU, but there's emergency facilities and specialty facilities across our state
No, I
that
get it.
sometimes have to
I just was digging deeper. on
Yeah,
that.
yeah, so when
Yeah,
we
we
talk
don't have a
about,
VRCP for anything incoming, because they would not have met the doctor.
that's right, so like being concerned about, can we do anesthesia without a veterinarian in the building? That's not the reality of what we're using these clauses for. The reality is ongoing hospitalization and care.
Okay,
So then I would say the ophtho one and the IV injection into an uncatheterized vein are the only ones I would propose to move to direct. So then
Just the two that you bring.
Yep, then the RVTs can directly supervise that, and then all the other immediate ones would be the vet. As we have already.
sounds good.
Were there any other comments?
No, I think we kind of circled back. My main concern was that if we kind of started picking apart that immediate supervision list and saying, you know, some RVT supervision, there would be kind of an offshoot of responsibility that what we're trying to prove with this list is RVTs are valuable for this reason. And then we kind of get a workaround in real life practice for veterinarians to not use it the way I think you're intending it to be used, but I think we're okay.
I think the concern is that if we previously established that doing tonometry or an IV injection was something that we would like veterinarians to have immediate supervision of. Or if there's an RVT present, they can provide direct supervision to that technician. However, if we change the blanket supervision from immediate to direct, even if there isn't an RVT present, an assistant can still do that now under general direct supervision. So are we okay with that?
I think we are,
Okay.
because direct supervision, the veterinarian is still on premise.
Right.
Okay,
The
So-
veterinarian does not have to be on premises, a supervisor has to be on premises.
right, I'm sorry. But
Well, but she'd already said if there's not an RVT, so supervisor has to be one or the other.
I agree, I'm just, with what he was saying, just want to make sure that it wasn't just limited to the veterinarian.
I still think to distinguish your point, we still want to distinguish, we don't want to move away from distinguishing the difference between RVTs and assistants. And so those tasks that we've assigned to immediate supervision, that means a veterinarian. That means there are things that you can do under a different level of supervision, which is direct or indirect. You guys have a more indirect supervision provisions than the assistants. That makes sense?
Yes.
I think we only had a couple of things under immediate that we can move over that would allow the RVTs to supervise an assistant. But, you know, those things that we deem to be critical, that it be either us or you doing, we need to leave those under immediate supervision.
Yeah.
And I don't think you want to be responsible
No,
for
I definitely think
for
anesthesia.
anesthesia and dentistry that's going on, being
Yeah.
done by an assistant, and it's your problem because there's no veterinarian available. You don't want that.
No, I chose to be a technician, so I would.
The guy wouldn't.
Does that make sense?
He was within health of this.
Yeah, it's just not. Not to have, go ahead, not to have a veterinarian on site, with a hospitalized patient, having done a procedure.
No,
Yeah, that's the one. Okay.
Dr. Shipman, we're gonna move on to telehealth. Is there anything you want to jump in with this RBT supervision assistance right now?
Nope, I think that was great conversation, and yeah, just wanted to make sure that we at least addressed it and contemplated that. But no, I think everything's good.
So we'll move on to telehealth. And in your packets, you have the AVMA guidance. It says talking about telehealth. And then you also have the packet that is the current telemedicine services and prescription. The first thing on there starts with abortion services. We will not be discussing that section. That's just the first page. So Indiana Code, Title 25, 19.5 is telemedicine services and prescriptions. Under this statute, veterinarians are practitioners, okay? So everything in this statute applies to a veterinarian. Note that it does not include RBTs, okay? At this time, it does not include RBTs. And veterinarians are also considered prescribers. This applies to you guys in the sense that you are practitioners. Obviously, HIPAA doesn't apply to you guys for a variety of reasons, mainly because you're not working on humans. But telehealth, under this definition, telehealth means the delivery of healthcare services using interactive electronic communication and information technology in compliance with HIPAA, including secure video conferencing, stored forward technology, or remote patient monitoring between a provider in one location and a patient in another location. The term does not include the use of the following unless the practitioner has an established relationship with the patient: electronic mail, instant messaging, fax, internet questionnaire, internet consultation. It also does not include healthcare services provided by an employee of the practitioner or an individual who is employed by the same entity that employs the practitioner, who is performing healthcare services listed in section 2.5A, 2, 3, and 4, and we'll get to that in a minute, under and at the direction of the practitioner, customarily within the specific area of practice as a practitioner. Some of this is very technical that would apply to physicians maybe, but not you guys, but we're just going through it now just so you're aware of what the current law is. So the healthcare services includes assessment, diagnosis, evaluation, consultation, treatment, and monitoring of the patient. And have those highlighted in yellow because in a minute you're going to see that those are the three that really are more focused for the practitioner, whereas the 2, 3, and 4 also apply to the practitioner, but the transfer of medical data, patient health related education, and health administration, whatever that means, when it doesn't apply, so the term telehealth doesn't apply to 2, 3, and 4. If your employee or another employee that is not a practitioner is performing. Does that make sense? A practitioner who provides healthcare services through telehealth or directs an employee to perform those health services listed in 2, 3, and 4 shall be held to the same standards of appropriate practice as those standards for healthcare services provided at an in-person setting. So this means the standard of care in an in-person setting applies to the standard of care on a telehealth visit, okay? I'm not gonna read this whole thing. But essentially, the practitioner who uses telehealth shall, at minimum, include the following. After ensuring a proper patient-provider relationship is established, obtain the patient's name and contact information, including a verbal statement or other data from the patient identifying the patient's location, and to the extent reasonably possible, the identity of the requesting patient. Disclosing the practitioner's name and license number, obtaining informed consent, and obtaining a medical history that would give you enough information to establish proper diagnosis. Discuss with the patient the diagnosis, the evidence for the diagnosis, and the risks and benefits associated with the various treatment options, including advising when it's preferable to seek in-person care. So operating under telehealth, you still have to maintain a medical record. When talking about prescriptions and primary care providers, we don't really need to go through that. But essentially, you have to, there's another section that we'll get to in a minute that the medical record keeping is the same that you would have to do under the Practice Act, whether it's in-person care or telehealth visit. Issue proper instructions for the appropriate follow-up care and provide a telehealth visit summary to the patient, including information that indicates any prescriptions that were prescribed. Yes.
This is primarily written for physicians.
This includes physicians, dentists, dental hygienists.
But not veterinary, this one did.
No, you are an explicitly listed practitioner under the statute. This is the current law.
Okay.
Now, HIPAA doesn't apply to veterinarians, so you don't really have to worry about HIPAA specifically, but you have to follow the law as it relates to you guys specifically. So they tried to write it as neutrally as possible. So this is that section where if the medical records have to be maintained in the same fashion as if you were an inpatient in an in-person setting. This section says that you waive patient waives confidentiality under a telehealth visit. I don't think that actually would apply to you guys very much anyway. This one I think is an important slide. An employer may not require a practitioner by an employment contract, an agreement, a policy, or any other means to provide a healthcare service through telehealth if the practitioner believes that providing a healthcare service through telehealth would, 1, negatively impact the patient's health, or 2, result in a lower standard of care than if the healthcare service was provided in an in-person setting. We will be making it, this section very easy to find on the website, just so you all know after this meeting. Because it does apply to veterinarians, and it has been in effect, I think, since 2002 or 2003. That's switch over. Oh, it's different. Okay. Any applicable contract, employment agreement, or policy to provide telehealth services must explicitly provide that a practitioner may refuse at any time to provide healthcare services if the practitioner's, or in the practitioner's sole discretion, the practitioner believes the health quality may be negatively impacted, or the practitioner would be unable to provide the same standard of appropriate practice as those provided in in-person setting. This section is for prescribers, and I'm not gonna read this whole slide. If you think back to what we talked about with the VCPR last week and talking about controlled substance, opioids, stuff like that, all of those laws apply. But one thing that I want to point out is this first paragraph. A prescriber may issue a prescription to a patient who is receiving services through the use of telehealth if the patient has not been examined previously by the prescriber in person if the following conditions are met. 1, the prescriber has satisfied the applicable standard of care in the treatment of the patient. 2, the issuance of the prescription by the prescriber is within the prescriber's scope of practice and certification. And then 3, the prescription meets the requirements of section B, which we'll see next. And then it's not an opioid, and it goes back to all of that stuff we talked about last week. So except as provided in subsection A, a prescriber may issue a prescription for a controlled substance to a patient who is receiving services through the use of telehealth, even if the patient has not been examined previously by the prescriber in person, if the following conditions are met. And then it goes through all of those things that we talked about last week, where probably really do need to have at least one in-person visit under federal law. So again, this is more of a highlight reel for you guys to just kind of get your understanding for what is actually required right now. So controlled substances have to be dispensed in accordance with state and federal law. Any questions on that so far? A practitioner who is physically located outside Indiana is engaged in the provision of healthcare services in Indiana when the practitioner establishes a patient-provider relationship under this chapter with, or determines whether to issue a prescription under this chapter for an individual who is located in Indiana. So this is the practitioner in California with a patient in Indiana, okay? Now, to be a practitioner, a veterinarian must be licensed in Indiana, okay? So the vet in California has to have a license to practice veterinary medicine in the state of Indiana. Practitioner who violates this chapter is subject to sanctions by this board under Title 25. And then a practitioner's employer or a practitioner's contractor that violates this section commits Class B infraction. That would be a criminal matter that you guys don't really get involved with. Nothing in this chapter requires an individual to provide or use telehealth. I think moving forward with any telehealth discussion, that is a very important slide, very, very important statute to remember that veterinarians are not required to use telehealth. And this one is directly for you guys. If a veterinarian is required to establish a VCPR to perform a healthcare service, the veterinarian shall ensure that a proper veterinary client-patient relationship is established as defined in the Practice Act when providing the service using telehealth. There's nothing, right? Oh, I didn't want to get to Ohio. Questions, comments, panic attacks? This slide that's up here right now, in the future, this is gonna come up. This is why we did the exercise last month at the meeting with the VCPR. This is why we're doing this exercise now. Establishing that VCPR is gonna be something that you guys are probably gonna have to tackle in 2026. Questions, comments, or anything before we move on to Ohio? And I think September 30th, 2025, Ohio's telehealth veterinary medicine services and practice requirements statute went into effect. We don't have to read all of this. The top highlighted part here, or bold part, a licensed veterinarian may conduct the practice of veterinary medicine via telehealth service if all of the following apply. This is very similar to what we already went over with the Indiana statute. Obtaining informed consent, advising or acknowledging the standard of care is the same as an in-person setting. Maintain documentation of the consent. Provide the client with your name, contact information, license number, alternative means of contacting the patient if the call or video fails. It's just making sure you have that continuity of care, you can reach back out to them. Make electronic or written records of the visit. Before conducting an evaluation of the patient, you have to let them know that ultimately you could recommend an in-person visit with a veterinarian. That the veterinarian is prohibited under federal law from prescribing certain medications based only on telehealth. Now that would include controlled substances and the veterinary feed directive drugs, right? And the telehealth appointment could be terminated at any time. And this one is explicitly for prescribing drugs, and it's mostly related to controlled substances. However, in paragraph 1 there, the veterinarian may issue an initial prescription for not more than 14 days. The veterinarian may refill for not more than 14 days if the veterinarian sees the patient for another telehealth visit, and for additional refills, the patient shall visit the veterinarian in person. Paragraph 2, the veterinarian should notify the client that certain prescription drugs or medications may be available at a pharmacy, and if requested, the veterinarian will submit a prescription to that pharmacy of the client's choosing. No controlled substances can be prescribed without an in-person physical examination of the patient. So D1 and 2 have to do with livestock and telehealth, and I'm going to skip these two because they're very, very particular. We can come back to that later if we need to do anything with livestock and telehealth. This is Ohio's VCPR. The main thing to note here is that the VCPR is established when all of these things happen, including the examination of the patient can be in person or via telehealth in real time. So it has to be real-time communication. It can't be watching a video of an animal from a couple of days ago or even an hour ago. You actually have to be having this two-way communication with the patient, the owner, and the veterinarian. And everything else on here is typical VCPR stuff. Questions? What?
So they're still using terminology for VCPR, having recently seen the bio. If you go back, it says, to me, that's gonna be
Yeah,
the
it says-
gonna be the sticking point for John and I and whatever other old curmudgeons exist in the state.
Well, it says recently, but it also says,
Immediately.
by doing any of the following, which would be examining the patient in person, examining the patient in real time via telehealth services, or making medically appropriate and timely visits to the premises.
Because it says in order to demonstrate sufficient knowledge, the veterinarian shall have seen the patient recently.
By examining the patient in person, by examining the patient via telehealth services, or visiting the premises.
That's why you highlighted that, so I would see it.
That's right.
But you glossed over it pretty quick.
I think it was the only thing I talked about.
You haven't seen anything.
She's hiding there because she knows what John and I are gonna do.
No, I don't.
Like I
Dr.
said-
Schnarr wants to embrace technology. He
I
said, get,
embrace technology, but if you're dealing with a client that's describing what's wrong with their animal, you're already behind the power curve. I'm sorry.
well, this doesn't say that you're talking to the patient. This says you are examining, or you're not talking to the client. You are examining the patient via video conference.
Well, I think that's the nice way of saying it. Double dipping. I don't think you can examine an animal, even real-time video, on a lot of things. Now, don't get me wrong. We've all, if a client has a cat and they say it does this, does that, and it comes into the office, it's going, it doesn't do anything. You know, I've told him, take a video on your phone, bring it in. That's different, you know. But for all medical care, making decisions,
That's not what this is saying.
well,
It's
Well-
not though. It's saying if the veterinarian hears the spiel and thinks they can help, then they can. They're covered and
Well,
protected.
yeah.
But if they don't, so then we have to
do it in
rely
person.
on the prudence of the vet, which is what we're doing right now anyway, just in veterinary practice, right? Then they can say, my recommendation, this is as far as I can go. Because this is not good practice to continue on this way. But like we had kind of talked about before, and I've thought about it a lot in the days since, in some of these exams or like phone conversations, we are doing telemedicine to a point. When I ask for a picture of a foot and it's, saliva staining or whatnot, then we have a discussion about side point. Well, you had it 6 weeks ago, it's time to have it again. That doesn't need, there's just so many things. Or like having a picture of an ear and you can say, ooh, that looks nasty, you need to come in and do a cytology. Then that's all I did.
I'm not arguing the fact that every one of us has done telehealth medicine and multiple times. But
So this is also, when we're looking at this slide, this is the creation or the establishment of the VCPR, okay? I mean, technically, you can create a VCPR in person by looking at an animal for like a broken foot or whatever, and then still have an established, 2 weeks later, you still have an established VCPR. Might not be for the same condition, so that matters, right? But you still have the VCPR. So if it were that situation that came up and you had that established VCPR, your professional judgment would say, I'm sorry, I saw you for a broken foot, then this is a UTI. Like, you need to come in, or you need to at least go get testing at the clinic or some other clinic or whatever before I can prescribe you an antibiotic. So I think what's already allowed have to be careful with thinking what's already allowed when it's the real issue and that it is creating that or establishing that VCPR. And then it'll say, then we'll go into when is the VCPR actually required? Is it? That's not what we discussed last week. Or last month.
I didn't say I agree with that either.
But
No,
again, those
I-
are statutes, right?
I know, I understand what you're saying. I was kidding.
And the veterinarians that own that said practice can choose whether or not they include that in the practice. So
Yeah.
like, you wouldn't have to do it at all, no one's making.
No, I understand that.
Okay, let's move on to the AVMA. Their Model Practice Act, the revisions that just came out this year. I don't have the whole Practice Act for AVMA, just this sheet. And you can pull that off of their website. The definitions here that they have are really nice, and they include explicitly stating when a VCPR is required, when it's not. So tele-advice means providing any health information, opinion, guidance that is not specific to an animal patient's health, illness, or injury. This general advice is not intended to diagnose, prognose, or treat a patient's physical or mental illness or injury. A VCPR is not required. Telehealth, which is the overarching term for all of this that we're talking about, tele-advice, telemedicine, teletriage, means the use of technology to deliver health information, education, guidance, or care remotely. Telemedicine means the practice of veterinary medicine through the use of telecommunication technology that allows a licensed veterinarian with a properly established VCPR to evaluate, diagnose, and treat a patient virtually. The teletriage is the safe, appropriate, and timely assessment and management, the immediate referral to a veterinarian or not, of animal patients under conditions of uncertainty and urgency via electronic communication with their owners. A diagnosis is not rendered and a VCPR is not required. Tele-advice and teletriage do not require establishing a VCPR and can be delegated to an appropriate staff member under indirect supervision. Telehealth service providers may also be used to deliver such services. Meaning, telehealth service providers may provide tele-advice and teletriage.
So that, in practice, is almost like a receptionist answering the phone. We train them to say hold food and that kind of stuff, and that's technically tele-advice.
It could be, I mean, if.
And they know, like, to ask questions related to blocked cat, so that's technically triage.
That would be, I mean, that would fall under the veterinarian's delegation and whether it's appropriate or not with that particular staff member. Now, this says under indirect supervision, so we would have to be careful if we wanted to adopt something like this, that, I mean, you would either leave out the indirect supervision or you would make it make sense for like the veterinary assistant, right? Because only a veterinary assistant can perform certain tasks under direct supervision, or like immediate supervision, so.
So
you would
Kelly,
have to make that match.
I think what they're trying to get at is after hours answering services, being able to teletriage or give tele-advice to get that appropriate care.
Makes sense.
So only a veterinarian licensed in insert state. Yes, I did leave it as insert state on purpose because this is just what their guidance says. Shall provide telemedicine services to a patient located in another state. Oh, no, in that particular state. So here it would be a veterinarian licensed in Indiana shall provide telemedicine services to a patient licensed in Indiana, or a patient located in Indiana.
What's the, can't think of it. There's a group on TV, Dutch. You know, I brought this up 6 months ago. They may be in Timbuktu and they're giving advice to, actually, they're scripting out certain drugs, I think, heartworm and everything else, right?
Well, I think the way Dutch operates, they refer the client to an in-state licensed veterinarian. I think that's how the process works.
Well, that's okay, yeah, but that would be teleadvice.
That's why we had that veteran that said he wanted to renew his license, he was gonna work for Dutch, he had to have an Indiana license. He would be able to practice telemedicine with Indiana clients and he's an Indiana license. That was.
Okay, you're right.
So far as I know, that's not crossing state lines yet.
Well, it doesn't matter if they're located in California as long as they have a license to practice
But
in
that's what I
Indiana.
mean, yes.
Yeah.
At least they're licensed and.
They have to be.
Right. I mean, you could have veterinarians in Chicago with a license in Illinois and Indiana, both can work for Dutch and take care of Indiana.
This next section is very similar to what we just saw in the Ohio section. You know, when you're practicing telemedicine, the veterinarian shall provide the client with the veterinarian's name, license number, physical location, an alternate method of contacting the client in case the electronic connection is lost. You have to use your professional judgment. Sometimes telehealth, isn't appropriate for the condition or the patient. Advise the client that telehealth may not be appropriate for that particular condition and that they need to see a veterinarian in person, obtain consent from the client, conduct all necessary evaluations consistent with currently accepted standards of care. Be readily available or have arranged emergency coverage for follow-up evaluation in the event of an adverse action or reaction. Confirm that the technology and physical setting being used by the licensed veterinarian to deliver telemedicine services has adequate security. Maintain medical records with sufficient information for continuation of care. Records shall be maintained for a certain amount of years. Prescribing medications via telehealth shall be done at the professional discretion of the licensed veterinarian in accordance with all state and federal laws, and it doesn't alter federal and state requirements and standards for the issuance of CVIs. Okay.
So really a lot of what, and going back to those definitions, is almost it's tele-advice more than it is, in a lot of cases, telemedicine or,
Not if you're prescribing heartworm.
well, you're prescribing, that'd be telemedicine, right?
Diagnosing.
But
I mean, if you're,
what, I'm trying to remember the exact words, telehealth.
So the AVMA requires the VCPR to practice telemedicine. And we've discussed this, I know. Currently, does the AVMA VCPR require an in-person visit?
yes,
AVMA currently still requires, but it doesn't say, veterinarians have arbitrarily said, well, I've got to have seen you within the last year. It doesn't specify anything like that. Just as like the Ohio recently seen. Am I correct? Is it AVMA?
I believe so.
What's right there?
But right now, even our VCPR definition doesn't specifically say physical exam, does it?
Correct.
Even though we assumed it did for a long time.
Dr. Shipman, do you have anything that you want to weigh in on with this discussion?
No, not particularly. I think it was a good review of what's currently in place, and I think it's a helpful review. I do think historically, I agree that definition or interpretation of seen has been quite vague. Though I do believe that some are interpreting it currently seen as not in person, so I think that's important to keep in mind. And if they are providing appropriate care, what does that look like? So I think it's important to kind of contemplate this of the standard of care and the judgment that is able to be executed by the veterinarian in consideration of it. We pulled Ohio's because they're both a neighbor and recently went through this whole process, primarily to demonstrate that we have the Practice Act where it stands today is not that far off from or at all needing to be changed, and actually has a lot of the guardrails already in place. It's just having this additional discussion and being very specific about telemedicine and making sure we're not inadvertently or advertently restricting the practice of veterinary medicine in the state based off of our our less restrictive current definition and potentially moving to a different definition for the establishment of the VCPR.
Anybody else?
Is there a situation where it's possible to gain a VCPR through your telehealth or tele-advice communication? Or does it first always have to be an in-person exposure?
Digging into it, right?
That's the
That's the
question.
big,
That's
that's
the
the big
$6 million
issue.
question. And I think a lot of us were assuming that you could not have a VCPR in Indiana without having recently examined and seen that patient in person. What Ohio's done here is said, you can make that VCPR just by using telecommunications.
Well, I thought I saw that on a previous
Yeah.
slide, and that's,
That's Ohio.
That's an Ohio statute.
but the AVMA,
Is similar, I think, in that we always assumed the AVMA for a long time established a VCPR. I do believe it had to have examined the animal. But I don't think that's the case anymore in their definition.
I mean, isn't the AVMA's position still that you have to have an in-person exam in order to do a VCPR?
It still is?
Yeah, even with all this definition of telemedicine,
So-
telehealth, they still want an in-person.
So that
so Ohio has gone against the grain, in essence,
well, and the AAVSV is the same way.
as Ohio.
American Association of Veterinary State Boards has always taken the more liberal viewpoint that you can establish a VCPR through telecommunication. You don't have to have it in person. And I think the AVMA always was reticent to do that. But what you're telling me right now, the AVMA's VCPR doesn't require a physical exam. But we were under the impression it did.
And I think they still
No,
have.
what they still.
Wait, I'm sorry, you said AVMA?
Yes.
AVMA's, their definition of the CPR is established with an in-person physical.
Yeah, they're still adamant about that.
Yeah, and not the AAVSV.
Correct.
Now,
They're
the
the
next
more
question,
liberal.
you went over the Indiana Practice Act. Clarify where, I mean, that was a lot of verbiage up there, but, you know,
Where do we stand here?
Where do
in
we
Indiana?
stand in relation to, I mean, I got the impression that Indiana is a little more loosey-goosey. The code is a little bit more loosey-goosey in the AVMA.
It just says exam, it
It
doesn't say
says
physical.
recently, it says
Seen.
recently.
Well, wait
seen.
a minute. Your question was about telehealth, correct?
Well, establishing BCPR, yeah.
Okay, well, that's two different questions,
All right.
but a VCPR is required for telehealth services that we just went through.
Yes.
Now, the definition of the VCPR just says an examination. It doesn't
Say how or.
say
Okay.
physical, or it doesn't say in person,
All right. That's,
But I
that,
think,
right?
And
I think Indiana's VCPR says has recently seen, correct?
that's where I was going.
But that doesn't necessarily mean it wasn't through a video.
Yeah, you're right. It could have been a video of the dog.
I think the assumption was we were like the AVMA. I always made that assumption.
And when we say, when we were talking about ABMA, that's off of their model practice act, right?
Correct.
So it's not like,
Well,
that's their recommendation,
But
not,
Indiana,
each state has their own, so.
Indiana's VCPR states has recently seen.
I'll pull it up.
Sure. And veterinarians took that to mean in-person physical exam. And arbitrarily, every veterinarian you can talk to will tell you their personal opinion was, I'm not dispensing anything if I haven't seen that patient in the last year.
Okay, is there a difference in between?
That was the veterinarian's choice, but almost everybody used that.
They can continue, I mean.
What's the difference between small animal and farm animal? Large animal, whatever you want.
Size.
Well, you can,
According to
Well, I mean, if you got a herd of cattle out
the
there.
veterinarian had to be on the premises.
It has to be
That's right, okay.
knowledgeable of their practice.
Of the
Practice,
setup.
the way they're doing, yeah.
Had to be knowledgeable of that farm recently.
And the word recent is not defined.
Correct.
Right,
Okay.
but almost everybody universally, if you were to talk to people at the IVMA meeting and said, okay, you're gonna dispense heartworm preventative to a dog that you hadn't seen yet this year, everybody's gonna say no. And they're gonna say, I can't because it's illegal. Right? Because it's been more than a year, but nowhere in there does it say a year. Recently.
And again, I think that's why it was initially left like that, so that each veterinarian could make that decision on what they're comfortable with. And if
She's got
some
it
want
up
to
there on
say,
the board.
hey, I need to see you every 6 months,
By
that's their prerogative.
recently seeing and personally acquainted.
All this wiggle room is supposed to help us.
Yeah.
So it says examination of the animal and recently seen. Ohio substituted that with the two statements saying either you saw it or you had a video. Correct?
Live,
Real time.
real time.
I don't think they substituted anything, I think they just added that you
Yeah.
could have a video conference. It's appropriate.
And I do think that's a good point that you just made there is I think Ohio is being more restrictive than some other states that we have seen in saying that the video must be real time, right? That's not pre-recorded, it's not text messages, it's still a real-time communication. So I think you could also instruct the animal owner to do different things to facilitate your examination of that animal.
You also need to remember that although we're talking about establishing the VCPR here, if you already have an established VCPR and you are doing telehealth services, you need to be following Title 25, right? with making sure that the client has the license number, the name, all the things that we just went
Yeah,
through.
I thought of that, you know, a lot of times when you're on the phone, to get all that information, it's difficult. I hate to bring up, but we just had a guy last thing where he's coming up with a new method to do that verbally. In other words, the phone call that you're on telehealth with, those words are being printed out and put into your computer. I mean, that makes more sense.
But our current VCPR is more in line with the AVMA.
No,
The language is.
well, yeah, but it doesn't explicitly say in person.
The question is, what's the interpretation of language?
But ours says an examination of the animal.
Doesn't say that's in person.
It was never relevant.
You guys are killing me.
Recent history. And the point is, this board could potentially by rule make that clear one way.
And Ohio has made that clear by saying examining in person or examining in real time data.
It's not just Ohio,
They're just the close one.
most recent. And ours, they were.
Like I said,
But there's still-
we're making recommendations here that, you know, maybe last 10 years, who knows what technology is gonna be improving, hopefully it'll improve in the
I
next.
think most states still have AVMA
That would be good.
rules, so to speak.
There's also a Supreme Court opinion that may come down and
Yeah.
address the whole thing.
The
You guys
guy
want to
from
do it?
Texas won his case. The veterinarian from Texas won his case because he said it was a violation of his freedom of speech to not be able to practice telehealth. And the Supreme Court upheld it.
Not the Supreme Court, the Fifth Circuit.
Yes. Okay.
But there's another case
Is
that
it going to the Supreme?
it's pending review, but there's another case that they heard that has to do, it's a Colorado case that has to do with, like a behavioral therapist, and it's kind of the same issue, same question. So that could directly affect veterinarians or any other professional.
So what do we have to do? One of the tasks you would like us to accomplish is to have a statement about telemedicine? Is that- No. What is the goal?
She said that real quick.
What's the ultimate goal?
Just noodle it, think about it.
It was just a learning.
And
I mean, eventually.
you may not have to do anything depending on a couple of different things that
Because
the
this,
I mean-
Supreme Court of the General Assembly
yeah,
say,
but
you know.
this is another situation though where we're kicking the can down the road like we were establishing what texting can do and what assistance can do.
We're not kicking it anywhere. We're gonna, if you have to address it, we will put that before you.
I mean, if you,
This is getting us all.
if you want to
educated on where
address
we
it,
stand,
then we can
where
come up
we
with a
stand.
draft for you.
So whatever
Yeah.
comes.
But right now, we're just trying to get a sense of
What is?
So when you go back to work tomorrow, and someone wants to video with you about a coughing dog, right? You're gonna say, oh, it looks like kennel cough to me. Come pick up your doxycycline.
I'm going to use my best judgment to follow
Now, if this is
the
someone,
standards.
suppose this is someone you've never seen before,
That should be different, I hope.
but it's not, according to Ohio.
I don't
But
care
he
about
still
it.
has
If
the
it's a
freedom to
real-time
practice
video.
as he.
But it's, if
Yeah,
it's
I'm not-
appropriate for that patient, it's not just that you can do a video conference with every single patient that calls up and says, hey, I want a prescription.
But that dog could be coughing because he's got tracheal bronchitis, or he could have congestive.
Right, and as a
bronchitis.
And that's why
veterinarian,
you
that's what you
use
say,
your-
we need you to come in, we need to listen to the lungs, we need an
What
X-ray,
was
we
it?
need.
A phone
Was
Was
system
it
in the back of
Ohio
his
that
throat.
said that you could get a 14-day script, not on, but you can
Yeah.
repeat it for another
You
14
didn't
days?
have another television.
Right.
So
Televisit 1, provide 14 days, televisit 2, another 14 days.
there's a difference
After
if he
that,
sees
you're
this, if he hears about this coughing dog, they can't get in for 5 days, and say, come in and get some doxy. But you gotta come in, and I've gotta see this. I could wishy-washy on that pretty good.
There's nothing that says that you have to
If it's-
participate in
If it's,
telemedicine.
I know, but if it's your client, there's one thing, and if it's somebody that, just calling up vet, trying to get something, is different, and I think we all do.
Trying to get what though, because you can't prescribe controlled substances without an in-person visit. I mean, is there?
Well, we're
a
talking
market for
about, well,
Antibiotics?
kennel cough here,
I mean,
antibiotic.
We all hated COVID, but it did open our eyes to where these things are now to the forefront as far as tele things.
I know, I still hate that. I've said for about 5 years, when we're gonna stop blaming the whole world, everything going on COVID,
Well, I don't think we're blaming it, I think it
Yeah,
forced
whatever.
us to, well, in this specific situation, it forced us to tweak things to survive, and then we went through it, and then we realized, oh,
There are
that
situations.
wasn't as still as I thought that would be, and it went well, and the client.
And you have to realize, I was not practicing, you guys were all practicing during COVID, and I totally understand why you did that, So,
So for me, and you as liaisons to the Attorney General, that's why I thought that was important, that we would know that. If someone does in Indiana, brand new client diagnoses it with kennel cough and prescribes doxycycline, theoretically, the way our VCPR is written, he hasn't established VCPR.
I would not say
Or has
that.
it? Because it does not say in person.
And Title 25 explicitly states that you can provide the telehealth service and prescribe without an in-person visit. The question is in the VCPR and whether or not that examination has to be in-person, hands-on.
So that's what we have to answer.
Yeah, and in those cases, eventually, if a person, to that, if a veterinarian talks to someone over the phone and diagnoses, trying to think of a-
But right now, you and I would need to make a decision how to advise the Attorney General if that case should arise, like.
Kennel cough versus,
Right.
did I diagnose
But it's
a
all the standard.
cardiac
care.
arrhythmia over the phone?
Right, right.
Exactly, so.
So that is what, it's all discretionary.
But
Are
Dr.
we gonna-
Clemente, it's all the standard of care, right? If you have to get your stethoscope out and listen, or the dog is in the clinic with you or via telehealth, it's the standard of care. You brief the standard of care.
We failed to do that.
10 years we'll be able to.
But you see what I'm
But I
saying?
understand.
If they show you a video of that coughing dog,
Put on it.
right, it sure looks like tracheal bronchitis.
Send it, yeah.
But then the dog gets worse over the weekend, goes to med vet, and med vet throws you under the bus and said, this dog's got a grade 4 heart murmur. Lungs are full of fluid. How did you get that doxycycline? Am I supposed to discipline that veterinarian?
But I think you've got to look at the big picture again. Was it a 15-year-old Yorkie? Or was it a 2-year-old lab that just got back from being kenneled for a week?
I get.
You take off. So I mean, I think that's why it's not all black and white. It's not.
And the question that you're asking is not, it's inappropriate. Well, yeah, but like, whether it has to be in person or not, the board has never established that.
I mean, I've never disciplined a veterinarian, but I can see where it can come up as telemedicine is becoming more common. It's gonna, as it becomes more common, those situations are gonna arise.
Which is why these discussions are
The younger doctors kicked me out of the clinic at the height of COVID when they said, everybody's gonna die in the next 3 weeks. Dr. Clementi, you better go home.
Enjoy your 3 weeks.
No. Here's a clinic laptop, medication refills, questions from clients that we already have a relationship with. Okay, and I'm doing FaceTime with them, right? But I got a vomiting dog, food and water for the last 3 days. I'm like, you're going to the clinic.
Not appropriate.
Which is
Yes, it
how
does.
this
Good
should work.
job.
So,
Keep your license,
so,
but you're not using it now.
This, the whole point is,
You
this is
go to
all
the clinic
based,
that he won't be there.
this is all based on making appropriate, intelligent decisions during the communication process of like-minded, what do you call it, other veterinarians that are, and it's in the definition. And so if you're out there in left field and doing something silly, then we can say, well, that's not consistent with your peers' decisions to be made in a situation like that.
And not just to keep bringing up the same example, and because, again, we've got a place to go with it, but your kennel cough dog over the phone ends up in emergency clinic, cardiac failure. The part of the standard of care is, besides taking all the account, how old is the dog, how big is the dog, where's it been, all those other aspects that you can get over the phone. You also have to have that conversation. Well, here are the things that I'm concerned about. I would love to be able to listen to the heart and the lungs and look in the mouth and this and that. It's 2 o'clock in the morning, or you can go to the emergency. You can go to the emergency clinic. Here's what I'm thinking. Can we try this? Here's what we can have you try, hoping that that's the cause. But if these things change, you need to be those. I think all of us would hopefully have those conversations.
You're
if it
also
comes
hoping
to
you're
this.
recording all that with Dr. Smiley's new.
He's hoping we're recording it with his with his software that he'll get money for.
yeah. And from our standpoint, you better be documented.
Yeah.
I think that's a lot like recording it with Dr. Smiley's
But I
software.
mean, I'm talking, I guess when I say document, I'm thinking written medical records. I get it.
Those are written.
Done right.
Yeah.
Yeah.
And you just
So
transfer
his
it.
system, he's talking in this type.
That's
I tell
exactly
you what,
what you said.
I like what he's trying to do, but I mean, documenting the way we just went through all that, what you have to have, how many phone calls.
That's why he's doing it. It's,
Yeah, you don't get
He's
all
making
that.
all that. And he's not the only one. There's 3, 4 other
Yeah.
companies that do the same thing.
True, and, in my mind, we're not, in private practice, we're not gonna use telemedicine a lot, a lot, it's gonna be more the man that is working from home. Well, yeah, that's a lot of paperwork, but that's all he's got to do all day, so the veteran that you were talking about, I remember his visit too, in that if he wants to make half an hour or an hour spots, like whatever he has to do for that, that's his 9 to 5, so let him deal with whatever nuisance comes with it.
We are. So, to that end, we can continue to chat, or we can move on with our agenda and determine if there's any old or new business that needs to be touched on. If not, is there any commentary for good of the order? Otherwise, I'm going to adjourn our meeting and we can just chat if we want to. Consider us adjourned.